on the odd chances that I do not already have your attention, I would like to introduce myself. My name is Blessings Mosugu. I'm a broadcast journalist and, of course, an events compere. And it is my absolute pleasure and delight to be standing in front of you today as your master of ceremonies. So please put your hands together for me. Thank you very much. All right, I'd like for us to do a quick exercise. I would like for you, if you're excited to be here and you are grateful for the opportunity to learn more about this conference, about PCOS, about issues that affect women, and you are grateful to the organizers and the convener as well, I would like for you to give them a standing ovation and a resounding round of applause. Thank you very much. Please rise to your feet as we celebrate the convener, the organizers of the PCOS Conference 2024. They put all of these together, and it is an immense opportunity to be here to celebrate women. Thank you very much. Thank you so much. You may be seated. Like I did mention earlier, today we shine the light on PCOS, polycystic ovarian syndrome, as a way to create awareness. Now, this platform allows people to get accurate information on this subject and, of course, get support as well, and even empower ourselves. Now, I'm sure that if I ask a lot of people about the PCOS, yes, we have the surface knowledge about it. We know about the irregular period. We know about the bloating or swelling or weight, whatever it is you want to call it. But we do not know all of these things in depth. And that is why this conference has yet again been put together. It's a beautiful initiative, and it has been going on, like I said, for 5 years. And it's my pleasure to once again be here talking about the PCOS Awareness Conference. And it's an immense honor to celebrate the convener as well, Mrs. Sheyi Amao, and all the organizers for making this possible. I'm going to go through the run-through of the event very quickly, but I would like for you to look in your hands. You have the program of event. If you have the program of event, let me see your hands up, please. Okay, beautiful. So look behind it. There is a puzzle there, and each one of you is expected to answer that puzzle. So what we're going to do is, during the course of the program, take your time, answer the puzzle, and when everybody's done, we're going to announce the answers, and there just might be prizes for those who get all the answers correctly. Is that a deal? Do we have a deal? We seem very cool this morning. Yeah, we're going to leave the spirit very soon. Okay, so a quick run through of our program very quickly. Today's lineup, we're expecting panel sessions, panel discussions. We're expecting a documentary to be played, the PCOS conference documentary, and of course, another documentary titled Where the Heck Is My Period by the delectable Stephanie Coker Aderinoko, who would also be addressing us right after that. We would also be discussing health in general and a fitness routine demo that will be done here live. There will be art therapy session as well, and of course, awards ceremony where outstanding individuals would be recognized. And then there will be networking sessions. If you ask me, that is like the most important part of every event, because getting to meet people is very pivotal in our society. And as you know, this event is packed full of activities. So once again, please put your hands together for yourself for choosing to be here this morning. A round of applause for yourselves, please. Before we go further, we'll be having the opening address. And to give us the welcome address is none other than a versatile and accomplished individual with a remarkable track record of achievements spanning multiple domains. Her diverse experiences and unwavering commitment to creating positive change have earned her recognition and accolades in various fields. Orode Meiwa Odwan is the Honorable Commissioner for Humanitarian Affairs, Community Support Service, and Girl-Child Development, Delta State. Before her appointment as Commissioner, she was the former Senior Special Assistant to the Delta State Governor on Small and Medium Enterprise Development. She is a multiple award-winning entrepreneur, a health advocate, and an author. Ladies and gentlemen, please, with a resounding round of applause, put your hands together as I welcome Orode Meiwa Odwagan to give us the opening address. Please don't stop clapping till she gets here. Thank you very much.
Good morning, everyone. We're too quiet. What's going on? Good morning, everyone. Can we just stand up and give like 5, 3, 4 people a high five? Let's get this place a bit warmed up. Maybe the AC is too cold for us this morning. High five. Make it loud. Make it very obvious that you're happy to be here, so that we can get the day started on a fiery note. All right, thank you. Good morning. My name is Oride Odwaha, and I'm the Honorable Commissioner for Humanitarian Affairs, Community Support Services, and Girl-Child Development in Delta State. I'm here to give the keynote address. Let me just first of all say I am so proud of my friend, Shay. I've known Shay since we were in secondary school. We were many things in secondary school, but it's just so amazing to see the path that we've both taken and seen her do some amazing work around this organization. So can we just give a round of applause to Shay and the team for raising awareness about this very important and sensitive issue. Distinguished guests, esteemed colleagues and organizers of this important event, I want to begin by expressing my sincere gratitude for the opportunity to speak at this crucial PCOS Awareness Conference. It's a privilege to be a part of this gathering that seeks to shine a light on a condition that affects the lives of millions of women, not just here in Nigeria, but globally. As someone with a background in public health, health management, and government service, I have witnessed firsthand the challenges faced by women living with various health conditions, particularly those related to reproductive health. PCOS, or polycystic ovary syndrome, which in layman terms is, hormonal imbalance, and it is one of such challenges that continues to be under-recognized and under-addressed. But today, thanks to all of you sitting in this room today, we are gathered to change that narrative. This conference comes at a time when raising awareness about PCOS is more urgent than ever. PCOS is not just a reproductive health issue, but a health concern that affects a woman's physical, mental, and emotional well-being. It is critical that we as a nation confront the issue head-on, ensuring that women receive the care, the support, and the understanding that they need. I want us to use today as an opportunity to share knowledge, discuss solutions, and take the necessary steps to make PCOS a public health priority in Nigeria. PCOS is a complex hormonal issue affecting millions of women worldwide, including a significant portion of the female population in this country. It is marked by hormonal imbalances that lead to irregular menstrual cycles, excessive androgen levels, which basically is male hormones, and the presence of cysts in the ovaries. Physically, PCOS manifests as weight gain, acne, excessive hair growth, and hair loss. But beyond the physical symptoms, PCOS significantly impacts mental and emotional health, often contributing to depression, anxiety, and very low self-esteem in some women, particularly due to body image concerns and fertility struggles. Despite how serious this is, the awareness about PCOS is still very low. I personally did not know what this was until my friend Shay started this organization a few years ago, and I'm a woman. In Nigeria, although data collection on PCOS is still emerging, it is estimated that between 10 to 15% of women of reproductive age are affected by the condition, with many cases going undiagnosed due to limited awareness and access to healthcare services. The burden of PCOS in Nigeria is significant, and it affects women's health, well-being, and reproductive capabilities, placing a strain on our lives and, in turn, our immediate communities. PCOS has some known causes like hormonal imbalance, insulin resistance, it can be genetics in some women, inflammation, lifestyle, but it also has some long-term risks that are severe, and they include cardiovascular diseases. So some women with PCOS are at higher risk of hypertension, high cholesterol, and other factors. Type 2 diabetes, insulin resistance, a common feature of PCOS, usually increases the risk of developing type 2 diabetes in some women. Mental health issues as well. So studies have indicated that women with PCOS are at higher risk for depression and anxiety, often due to distress caused by physical symptoms and reproductive challenges. The causes and long-term risks might sound very scary, but there are known treatments that support and help women, and they include lifestyle changes. I always see my friend post about healthy diets and exercising all the time. There are medications, there are fertility treatments, and in some cases, a very severe one, surgery. We should note that treatments are tailored to each woman's needs, so it's not a one-box-fits-all. Given the significant health burden posed by PCOS, there's an urgent need for early diagnosis and access to effective treatments in Nigeria, particularly in underserved areas. I can tell you that the conversation around PCOS is still very silent in many states across this country. And I'm hoping that this organization and many of you sitting here in this room today can carry the burden of spreading that awareness across our nation, Nigeria. Government support and initiatives in Nigeria are very essential in promoting women's health. The Nigerian government recognizes the importance of addressing PCOS as a public health issue, but efforts are still in the early stages. There are several health programs aimed at women's reproductive health. Those specific initiatives targeting PCOS still remains very limited. However, there's a growing momentum thanks to organizations like this one that has gathered us here today, and momentum for policies and programs focused on improving diagnosis and treatments of PCOS. For example, there's talk around affordable access to healthcare, ensuring that women have access to affordable diagnostic tests. There are talks around awareness campaigns, increasing the awareness campaigns, particularly in communities. So we have this organization doing awarenesses for us here. We're in Lekki, we're in a nice hall with air conditioned and nice balloons. But there are women who are going through the same challenges in very rural communities that possibly have no idea what they're dealing with. So we need to increase those awareness campaigns and take it down to the very rural rural women or very least communities that may not have access to the kind of information that we have sitting here in the room today. There's also increased talks around support for research. Government support for research on PCOS is critical in advancing our understanding of the condition in Nigeria, including the development of locally tailored treatment options. There's a call for continued engagement with policymakers to push for stronger governmental action in addressing PCOS. By working with local representatives, the public can advocate for comprehensive healthcare reforms that improves access to necessary treatments for PCOS. Private partnership collaboration in Nigeria cannot be overemphasized when we talk about women's health. I believe that private sector partnerships are key to supporting public health initiatives, and in this case, PCOS. A few years ago, I started a foundation called the Pink Pearl Foundation in 2007. I was age 18 at the time. And one of the most successful things that we did was partner with a company called JNC International. And we donated a digital mammogram to a hospital in Delta State, in Saple Central Hospital. At this time, that was the second digital mammogram in the whole country. And it went a long way in supporting cancer care for that region. So collaboration between healthcare providers, research institutions, pharmaceutical companies, and non-profit organizations can drive innovation and enhance access to affordable treatment options. These partnerships can come in different forms, but it is essential that they happen, particularly for us on the government side. In Nigeria, the role of private partners is essential in developing innovative treatments, advancing research, and knowledge sharing. By fostering strong private-public partnerships, we can make a significant stride in addressing the public health challenges posed by PCOS. In conclusion, collective action is critical to improving the lives of women with PCOS in Nigeria. The government, private partners, healthcare professionals must work together to advance awareness, research, and treatments of this condition. By doing so, we can reduce the long-term health risk, improve fertility outcomes, and enhance the mental and emotional well-being of women with PCOS. There is hope for a brighter future. With increased awareness, better access to treatments, and ongoing research, promising to transform the care of women living with PCOS. With joint efforts, we can significantly improve the lives of millions of women affected by this. Let us engage in proactive conversations about PCOS. Women are encouraged to seek early diagnosis and treatment. Early diagnosis and treatment. I also want to encourage us to prioritize healthy lifestyles and advocate for better healthcare access. Support local and national organizations that focus on PCOS and encourage local representatives to push for stronger government support in addressing this pressing health issue. Let me say a heartfelt well done to all of you here involved in diligently creating this awareness and solutions for PCOS. Well, particularly to my awesome friend Shay. I'm so proud of you. So proud of you. I wouldn't have thought that we would both be standing here today doing some amazing things, but your courage and your bravery and your vulnerability to this cause is not gone unnoticed. We see you, we love you, and we support you. Please, can we just give her another round of applause? I know that I'm very proud of you, and I'm very proud of the team for putting this together for 5 years. And I will continue to support you in whatever you do to help other women. I will particularly support you when, not if, when you bring this awareness to Delta State. When you bring this awareness to Delta State. Thank you once again, and let us enjoy the rest of this conference. Thank you all.
Ladies and gentlemen, once again, please put your hands together for the Honorable Commissioner for Humanitarian Affairs and Girl-Child Development, Delta State, Orodemeiwa Uduan. Thank you so much for that. One thing she said that stood out for me was that there is still hope for a brighter future. There is hope for women in our society, and not just those in urban areas, but those in rural areas, especially if we can spotlight these issues and create more awareness for them, you know, allowing them to know more about this, and of course, giving better access to healthcare. Thank you once again to the Honorable Commissioner. Now, very quickly, there is a special address from the Lagos State Ministry of Health, because of course, this is a very pivotal issue that affects not just the women, but everyone in the society. So, ladies and gentlemen, to give the special address is the Director in charge of Special Projects and Mental Health, Lagos State, the Ministry of Health, representing the Permanent Secretary, Dr. Olusegun Ogboye. Ladies and gentlemen, please put your hands together as I bring up stage Dr. Tolu Ajomale to give the special address. A round of applause, please.
Good morning, everyone. I'd like to start by recognizing every one of you seated here today who are being a part of this program. But I want to ask a question. Is this the first PCOS conference being organized by Sheyi and Anu? No, it's not. The fifth. Where were the others? Anyone know? The other four, where were they? Online. This is the first physical conference. Second, where was the first? Where? Fantastic. A round of applause for her. You're wondering why I asked. So the Honorable Commissioner just mentioned, you know, about coming to Delta. But of course, every great thing has to start in Lagos. So we're really happy that we've had the first and the second conference here in our great state, Lagos State. And I'll like to also bring warm greetings from the Ministry of Health, from our Permanent Secretary, Dr. Olusegun Ogboye. The issues that have been raised by the Honorable Commissioner are very pertinent ones, but I'd like to emphasize on some parts that we may have overlooked. We know that many women have reported, you know, difficulty conceiving and having children. We know the implications of that for the woman and the Honorable Commissioner has mentioned quite a few of them. But we also know that there are stronger implications in terms of social life, family life. Think about the idea of a woman who gets married. She's celebrated with the rest of her family, loved ones, friends. And then 1 year, 2 years, 5 years, 10 years in the marriage, no children. And we live in an African environment. We understand the implications of that, especially when you have in-laws who are being really difficult and are not being as supportive. And then you've gone to the hospitals, you've tried so many different things, and nobody has been able to provide an adequate solution. I remember that one of the drivers for Sheyi for creating this organization was because she was looking for answers. And then she eventually did find answers. But there are many women who haven't found answers. There are many women who are living with PCOS, but they do not know that they have PCOS. And many of them visit facilities that do not have either equipment or skill or capacity to make that diagnosis. And very often, if you're a doctor or you grew up or you went through medical school, it's one of the things that you would have learned there, polycystic ovarian syndrome. But it's always something very arbitrary, very few, and I think I could speak to 1 or 2 cases that I saw when in medical school. But in my practice as a public health physician, particularly around mental health, I've also had occasion to also meet women who are struggling with PCOS. There are a lot of critical issues that we need to highlight and possibly discuss. And I think they are majorly in 3 dimensions. The first is creating awareness. What is PCOS? A lot of people need to know about PCOS. Because once you are familiar with it or you know someone who would learn about it, you also create opportunities to identify people who may need help. So once you learn about it, and very often it happens, when you're in gatherings or you're in programs, especially around health topics, and people are discussing signs and symptoms, you begin to picture them. And sometimes you begin to remember people that you might know that may be struggling with some of them. So awareness is very important, it's very critical. And in awareness, you need to think about it in 3 dimensions. On the dimension of those who are educated, who you can communicate with research, you can communicate with in terms of language as well. You also need to think about those who are not as educated and the ability to be able to translate the large language and the medical terminology into simple terms that people can understand. And then you need to think about the 3rd category, people who may stigmatize those who are living with PCOS because of ignorance and because of low level of knowledge and literacy. So there's a 1 dimension. Awareness becomes very important because it creates a demand, it creates an effective demand, because the more people are aware, the more willing they are to now seek care. And that leads to the 2nd step, access to care, access to diagnosis. The first step, of course, before you can get treatment is to get a diagnosis for whatever it is that the person is struggling with. And so we need to look at how to improve the capacity of our health facilities to provide access to diagnosis and then access to treatment. We have quite a number of health facilities here in Lagos, especially on the private side, who are doing a lot of work around women's health. And a lot of them have been very effective in doing incredible work in supporting women and women's health. But we also know that there's some limitations to that. If you do not have health insurance or you do not have money, you may find it that it's a bit more difficult getting access to care at a private facility. And so on the public side, you now also begin to explore how we can improve access for women who may need that diagnosis. Last year, the Honorable Commissioner for Health started this conversation, especially around PCOS. And we're looking to identify possible partners in both public and private sectors who can help create a program to improve diagnosis and improve access to treatment. One of such facilities that we have identified and we're planning to pilot with is the Lagos Island Maternity Hospital. A lot of people have been born there, and it has a very long history of providing treatment and care for women. And because it's a public facility, it means that it also opens up access for those who do not have higher levels of income to be able to get care. We have found and we have been able to procure some medical equipment to be able to support this. We have also identified space within the Lagos Island Maternity Hospital to be able to provide access to diagnosis and treatment. But then the third step becomes more important. When you visit a health facility, a primary care center, your private hospitals who aren't specialized in women's health, we also need to increase the capacity of our health workers to be able to identify so that they can refer appropriately to facilities where this care is available. So whilst on one hand, as a woman who may be suspecting that you have PCOS and you go and meet your doctor, very often the doctor will overlook it and think of other things that they feel are more common. So we have a lot of work to do also on the part of healthcare workers to improve their awareness so that they have the skills to be able to identify early women who are living with PCOS and then provide access to treatment for them. The work for us is a lot, and we are very happy that PCOS Conquerors are also doing incredible work in this space. Shay is doing amazing work, as well as Anu, and they have been in touch with us to describe in detail some of the things that they have been doing in the past. I, on behalf of the Ministry of Health, would like to say that we are extending an arm of partnership with you, and we are willing to consider and work together to improve awareness, training for healthcare workers, also access to treatment and care for people who are living with PCOS. I have seen the program, and I know that there are a lot of details that have gone into it, and we have a lot of experts who are present in this room to give us a lot of information. So I'd like to challenge you, while I round up, that your being here isn't just for you to learn, but it's also for us to create champions in this room who can also go out into their different spheres of influence to be able to speak about the subject, to be able to create more knowledge in our environment, and also to be able to translate that information into ways that people can easily understand. I look forward to hearing the outcomes of this meeting, and also, more importantly, to be able to get actionable points that we can work with as the Lagos State government. Because like we always say, everybody can do it, but we will do it first, because this is Lagos. Thank you very much.
Once again, a round of applause for Dr. Tolu Ajomale, the Director in charge of Special Projects and Mental Health, Lagos State Ministry of Health. Thank you so much for that, and thank you for the opportunities and possible partnerships, and we're looking forward to that as well. Very quickly, I mentioned earlier about the polycystic ovary syndrome and how that a lot of people have no idea about it, and of course Dr. Tolu Ajomale also emphasized that, including the Honorable Commissioner Orode Uduaran. Now, that said, the next item on our agenda will set the tone for what we're here to do and to give us a better understanding of the PCOS. So ladies and gentlemen, please focus your attention on the screen for the PCOS documentary screening.
The promise that he gave me when I was scan table and telling God that this wasn't the promise that he gave me when I was going to get married.
This has been the most toughest phase I've ever been in my life, in my entire life.
Now the big question, are there ways to prevent PCOS? The answer is no, because we don't even know what causes PCOS.
Imagine a young woman with every step. This is the reality for millions living with polycystic ovarian syndrome. In 2024, 8 to 13% of women of reproductive age are living with this condition, yet up to 70% remain undiagnosed. In this documentary, we shine a light on these hidden battles. You will hear from experts and meet brave individuals living with PCOS. They share their real-life experiences, pains, and resilience.
PCOS, also known as polycystic ovarian syndrome, it's a syndrome, as the name implies. So it's just a syndrome means it's a collection of signs and symptoms which constitute a disease.
I'm very, very happy we are having this discussion on PCOS because it's something that impacts mentally, psychologically, physically on women.
As a radiologist in training, I've been able to see quite a few. When a lady has a polycystic ovary, what to look out for is the number of follicles that are lining the periphery of the ovaries. Once we are able to locate close to like 20 to 25 follicles lining the periphery of the ovary, then you can now make a diagnosis of polycystic ovarian syndrome.
By the time I found out about having PCOS was way later than expected. Reason being because there were symptoms, there were things that were shown. So, for instance, I had irregular periods, I had, acne and all of those things, but it was never something that I was bothered about because, first of all, I was not the kind of person that used to sleep around, so I didn't think, we heard stories as a young child that, see, if you so much as talk to a guy, you get pregnant. So those kinds of things had stuck in my mind, and so it helped to shape the kind of person that I was. So when I got married 5 years ago, we were not, it was more like we just wanted to start our journey without the pressure of having children, right? And so the first year, there wasn't any pressure to get children or to get pregnant at that period. So we didn't think about going to the hospital or anything. My periods were coming irregular as they used to, but it wasn't anything that was concerning.
I got married in 2017 precisely. I got pregnant 2018 around January. I did not even know. But after like 2 months, I miscarried. So I came back to Lagos because I was not staying in Lagos. So I came back to Lagos and I found out that I'm having blighted ovum, so I had to do evacuation. Then shortly after I conceived again, then I had a miscarriage again.
For women with PCOS, diet and lifestyle is a first-line treatment. That's because women with PCOS struggle with weight gain. And with excessive fat accumulation, they can have insulin resistance, And most times, what people don't know is that insulin resistance does not just cause, of course, it increases the level of male hormone in the blood, and can result in infertility. Of course, it results in irregular menstrual cycle. But that is not all there is to it. It can also predispose them to type 2 diabetes.
Okay, my years of marriage has been 7 years with no child. This year alone, I tried committing suicide. February, thank God for good neighbors.
It was so tough because at that time it was my mom. Oh, Father God.
The partners involved, especially men, is very, very important in when we're talking about management of PCOS. We talked about support group, and for example, for couples, for people in relationship, you need to hold people's hand. The fact that your girlfriend has PCOS does not mean you should then break up with her. No. At that period is the period of no, because trust me, a lot of things go through their mind. Walk with them, understand with them, journey with them, visit the doctors with them, support their nutrition journey, support their diet journey, support their therapy. They need you.
I can't really socialize more because I'm very scared of what people will say to me. I'm very scared of how people will make me feel. I don't want people to make me to feel sad because it can be depressing.
If we could have these children, we will have them. And so I believe that, with this documentary, it will help and it will go a long way to help women living with PCOS to become better, to become, to live a more full life as opposed to just living with the stigmatization of PCOS.
The face or hair, hair growth, hormones, or irregular menstrual flow, but it goes way beyond that. A lot of women are going through a lot, as you've seen, And I think the onus is on everyone. It's not just for the women who are going through it. We're not creating the awareness just for the women who are going through this, but so that as a society, as a community, we can hold the hands of everyone who has experienced or is experiencing this. Once again, thank you for watching, and please put your hands together for that effort. That was a beautifully done documentary by the team. Very quickly, we'll be taking the welcome address, and that will be done by the convener. Right now, we would like to invite someone who is more than a marketing strategist. She is a reproductive health leader. She's more than just a brand marketer. She's also indeed a force and a thought leader. She's more than just an author. She's also the creative brain behind this initiative, the PCOS Conquerors, and of course, the PCOS Conference. And she is the chief conqueror herself, one who chose to use her story to shine the light on a major issue. Ladies and gentlemen, please make welcome the co-founder and chief concerned of the PCOS Awareness Conference, Mrs. Sheyi Amao.
Welcome. I feel like dancing. I know, but no, not just any dance. DJ, do you have? I think it's Mema. Do you have that one? Always on time. Oh no. First it was favor, then it turned to fire. You don't have that one. That's what I know. I should have briefed you. Which one? I don't know that one. Let's see what he has. Sorry, pardon me, but I have to give all the glory first to God. You can just be like 2-3 minutes, and I would really appreciate if everyone, so I'm not awkward by myself, if we stand up, let's dance.
Come on now. Baby, what? Say what? Are you ready for step 2? Are you ready for step 2? 1, 2, 3, let's go, say.
Amen. Thank you, everyone. Thank you very much. Anyway, so let me just pray quickly. Lord, thank you for today. Thank you for your grace. Thank you for the ability to take something that was truly painful and turn it into something beautiful. I give you all the glory. I give you all the honor and adoration. To you be all the praise. In Jesus' name, amen. Whew. I'll just say that first, giving honor to who honor is due, but then the second person I would also want to recognize in this moment is Omilola Oshikoya, specifically for her Richer Woman Foundation, because she took 9 months out of her life to train and mentor people, gave us access to all your faves, from Glory to Top Money, People Money Africa, just as a woman if you were lost. And I remember in 2019, I was lost. I had dealt with prolonged bleeding for about, let's say, 2 different spells of it. I bled in 2015 from April to September, non-stop every day, you know, and you don't realize how traumatizing that can be. And I wasn't diagnosed. And getting married, I think I got married the following year, you know, trying to figure out, okay, what's going on with my body and everything. So that 2019, I remember I listened to a voice note, and I remember how broken I sounded because, you know, not only was I confirmed to have PCOS, which I was like, I didn't really pay attention, but what troubled me was the prolonged bleeding. And then, you know, having to do polyps removal, which is another, I'm sure the doctors can address that. You know, I was trying to find out what's causing me to bleed, not really having a solution, you know, having to do operations twice. So I remember that, like, it was in July. I woke up in the morning and I was so frustrated. I was like, God, what's going on with my body? And as I was writing, I was crying. You know, I think, you know, 1 second I'm writing, I'm crying. I'm like, it like dawned on me that no, this thing is not going to be the end of me. And literally that's how I got, you know, I'm more than a conqueror. And I was like, PCOS conquerors. I really didn't have a plan. I just wanted to open up and express, you know. Such an amazing community. I mean, apart from Instagram, where we have, obviously you see the numbers of followers, but specifically within our WhatsApp group, you know, people that have joined, like I shared online, blocked fallopian tubes have been opened, like literally, it's blown my mind the way people that were lost when they joined have found like some kind of strength. Like at this point, I don't even need to even say anything because we have women on the group that we call Sabi Mamas. They've come to, is there any Sabi Mama here? Woo! They've come to the point of where they were lost and depressed to a point where they're like, you know what, we're going to take charge of our health. So yeah, my testimony in a sense is full in that regard. And I just want to circle back because already had shared a couple of things of, what we need to do going forward. Like we can have beautiful, like it's a beautiful venue, but the way my heart is thinking around this thing is that we need to start going really hard into the economy to address its solutions. I don't want to have a conference like, okay, conference, let's sit down. I want to have, this is a marker. The 5 years, like this is what we've done so far. And then the next 5 years, we're going to look again, okay, we have a 5-point agenda from this conference that will meet the government, that will meet different organizations, partner with them, and that we're working actively so that when we reach 10 years, we can see. So now I wish I had sat down to do the statistics. Women that were told they couldn't conceive, they've been able to conceive, and that's beautiful. But what is in my heart the most is thank you very much. But what is in my heart the most is metabolic issues, because even after you conceive, no one is talking about diabetes. No one is talking about fatty liver disease. No one is talking about the fact that as women, we feel pain, but we ignore. And I'll give you 3 instances in my life. I went blind. I mean, my mom is here, and she's probably wondering, wait, when did you go blind? But literally, I lost my sight, barely able to see. The first time I was 11, I think, in school. We were running outside, and I fell down, and I got a really bad scrape. So by the time they brought me into hostel, I remember standing, and I was walking, and all of a sudden, I couldn't see. And I was like, okay, what's going on? Everything's like, check out. It was really, but I just kept quiet thinking, okay, I'm not really sure. They are leading, and I was a young girl. They are leading me to the health prefect. So after a while, my eyes cleared. And I'm like, okay, I don't really know what that was, but, you know, I'm fine now. The second time it happened to me was when this was in, I think I was maybe 21 or something. I was living with my sister-in-law and my brother in England, and I don't know what I ate, but something triggered a reaction in me. And before I knew it, I started running temperature. I said, okay, let me cross the street to go and buy like medication, and on my way back home, I'll rest. Now, while I was in the shop, my eyesight started dimming and dimming and dimming, and I'm like, what's going on? I didn't really say anything. I just took the money, but I crossed the street, which was actually very dangerous because if a car was coming, I couldn't have seen the car. But thankfully, my brother's house was across. But by the time I got to his house, I couldn't even open the door. I was like, and then my sister-in-law was pregnant, and I was like banging on the door, and she's like, what's going on? And I was like, oh, I can't see. And then she just laid me down, and after a while, it cleared. Now, the third time, this was probably either 2015 or 2016, before I got married. Then my body had even started changing. I was dealing with, like, obviously the self-esteem issues of, oh, I don't want to look this way when I get pregnant. Not when I get pregnant. When I get married, I want to be fit. And I got a fitness instructor. And yeah, by the time we're done with the fitness round, I was like, my husband then was my fiance, can testify. I just said, I can't see. And I sat down. And I mean, it was just funny that when I think back, those are actually very, very serious things that somehow I didn't really maybe go and see a doctor or address. Once my eyesight got back, the fitness instructor said to me that, oh, maybe I worked you a bit too hard. So I was like, yeah, maybe. And then that one, you know, I just went to my wedding, dressed up as I could. I remember that day I had a little bit of a pout, so some people were even thinking I was pregnant, but lo, it was PCOS belly. So yeah, so the moment when I woke up and I said no, that I needed to figure out what was going on with my body was my heyday. And it was the day I said, apart from just waiting for things to happen, I'm going to be proactive, I'm going to learn more, and whatever I'm learning, I'm going to share. And it is my desire that people are healed. I mean, to God be the glory, like, if I show you my app and how long I have bled, like 2021 was another case of bleeding. But since that May, and since that one, I'll say God healed me, because there's just no other way to explain it. I mean, I've been doing the right things, but that particular issue, it stopped. And since then, I have been more proactive with my health. Obviously, it's a challenge when it comes to having to work in an environment sometimes that is stressful. And, you know, I am so knowledgeable, and I can see that, oh, I'm working in this environment and it's affecting me. So how can I start getting employers more involved? How can I start getting more people talking about it? So when you as a woman, you're asking for some time off just to recruit, you know, your boss doesn't take it that, oh, you're being lazy. So it's really an honor to have everyone here. I don't want to go on too long. It's been a journey of being vulnerable. It's been a journey of being open. And it is my prayer that as everyone has come here today, we're going to learn, but then not only learn, we're going to take action steps of what next to do, not only for the women here who may have PCOS and maybe not, maybe they need to get checked out, to know that no, you don't need to be afraid. You are able to live a normal life. You're able to conquer and reverse your symptoms. And for other people that are allies to also enable such women, it's not just PCOS, going after reproductive health disorders in general. You know, women deserve good health. They deserve to thrive. We're the bedrock of the home, because at the end of the day, life comes from us. So, and we need it. And we need to get to a place where we no longer ignore the pain. We get it checked, we get it addressed, and we can conquer whatever situation that comes our way. Thank you very much.
Once again, a resounding round of applause for the co-founder. Thank you so much for that. Thank you so much to the co-founder and, of course, to the entire team for putting this together. How many of you has learned something new about PCOS today? Don't worry, I won't put you on the spot, but if you're sure that you've learned something new that you didn't know before about PCOS, let me see your hands. I know I have. Thank you so much once again to the entire team for making this possible. Now, without wasting much time, we're going to the next segment, the next program on the agenda, which is the panel session discussion, the first panel session discussion. And this will be centered around empowering health, innovative medical solutions for period problems, metabolic changes, and infertility. And I will be handing over to the moderator now. The moderator is a seasoned strategist with 15 plus years of experience driving impactful projects in agro-space and, of course, impact investment. As program manager at Impact Investment Foundation, she leverages expertise in project management and stakeholder engagement, enhanced by certifications from Harvard Business School and Lagos Business School. Ladies and gentlemen, the moderator for the first panel session is none other than Chidima Stella Azike. A round of applause, please, as she comes up. Don't get tired of clapping. It's still too early to get tired. A round of applause, please.
Hello, good afternoon, everyone. How are we doing? Okay, so my name is Chidima Azike, and I'm honored to be moderating this panel session titled Innovative Medical Solutions for Period Problems, Metabolic Challenges, and Infertility. So as we've heard today that a lot of women who struggle with PCOS remain undiagnosed and untreated. And it's quite interesting because this is a leading cause for infertility issues. So 2 studies were carried out in Nigeria that actually showed the prevalence of PCOS at 18.1% and 12.2% respectively using the Rotterdam criteria. I believe this highlights the need for us to actually have this conversation today as we discuss the complexities of PCOS and what medical interventions actually exist to help us overcome these challenges. So pretty much, I'm not going to waste much time. I'm just going to call up our speakers to please join me on stage so we can get the conversations going. The first speaker I would like to call up would be Dr. Abosede Lewu, popularly known as Naija OBGYN Doctor. Please join me on stage. Thank you. And our next speaker, who will be joining me on stage, is Dr. Yakubu Usman from South Shore Bloom Clinic. Thank you. So I'm just going to start with you, Dr. Lowe. Please, would you introduce yourself to the audience? Thank you.
Hello. Can you hear me? Okay, great. Seems it's working. Hi, everybody. Good afternoon, everyone. We need to get our energy up. The AC is really, really working. I've been feeling sort of cold up there. My name is Dr. Abosede Lewu. I'm a consultant obstetrician and gynecologist, and I'm also the chief medical director at Orbo Men's Clinic. And I'm very excited to be on this panel. One of the work that we do is help a lot of women that have various types of hormonal imbalances live a more healthy life. And I'm really excited about PCOS coming to the forefront because as it's a learning for women, it's also a learning for we healthcare practitioners, and I'm sure as we'll talk, we'll shed more light on that. Thank you very much for coming.
Thank you. Can we a round of applause, please? Thank you. Dr. Usman, please introduce yourself. Good afternoon. Thank you. So now my first question will be directed to you, Dr. Usman. And it goes, recent research suggests that PCOS might be more than just an ovarian disorder, potentially involving multiple body systems. How has this understanding changed our approach to PCOS diagnosis and treatment?
Be able, because the default state is for every cycle, every month, you are supposed to release an egg. The lining of your womb is supposed to be ready for pregnancy. That is the default state. But however, we know that that doesn't happen. When there is no pregnancy, there is a shedding. Secondly, the metabolic aspect of this condition, this disease condition, is where it matters most. That was why one of the speakers said that the trend now is to even go beyond the fertility aspect, because somehow we're getting some solution. But the metabolic problem is still a challenge, because that goes to affect virtually everything, right from your hair down to your tail, your toe. So that means it's a multi-systemic disorder that affects virtually everything in your body. So we're talking about in the immediate complications and the long-term complication of this disease. So we're talking about your lungs, talking about your heart, we're talking about your blood vessels, we're talking about your kidneys, we're talking about your skin, even your hair. So how do we, what are we doing, to ensure that we change the narrative? Is to ensure that, one, the awareness that is being created is one way of ensuring that we can get to improving knowledge about this condition. Because if you're able to get the woman to get pregnant, how about the long-term complication? I give you, for example, because of the chronic unexposed exposure of the lining of your womb, which we call the endometrium, to one of the hormones that is very, very notorious in furthering the advance of this disease condition, which is the estrogen. Most women even risk having conditions we call endometrial hyperplasia, or even in worst case scenario, neoplasia. That's endometrial cancer. So we're looking at ways of ensuring that we limit the progress of this disease condition. Having diagnosed this disease condition, taking care of the immediate situation, the symptoms, the challenges of the client that is seated before you. Because it's one disease condition in which the treatment is based on the client. So it's a patient-centered or individualized care that is offered. You have a scenario where you have somebody who is just starting her menses within her teenage years or early adulthood. The treatment criteria for that person will differ for somebody who's advanced in age or somebody who is even perimenopausal. So we individualize the treatment approach to this condition so that you are treating the particular symptom that the patient is presenting with in the immediate time. But generally, you are looking at how do you prevent progression of this disease condition and then limit the long-term sequelae, some of which we're going to be discussing in the course of this program.
Thank you very much for that detailed response. My next question is for Dr. Lewu. Insulin resistance is a key feature in many PCOS cases. Can you discuss some of the latest strategies for addressing this metabolic aspect of PCOS beyond the use of metformin?
Okay, so I always like to start the conversation about PCOS by doing something I call Anatomy 101 for everybody. And that is basically for us women to understand that we're born with a fixed number of eggs. And what happens is the menstrual cycle, once you're matured enough, what does this mean? The day you start to see your period, that's the day you start to release 1, 2, depending, like if you have twins in your family, you may be releasing more than 1. But what happens, just like you mentioned, with that maturity of the HPO axis is that your brain, your whole system, and your reproductive organ, they have this synchronous dance that they do regularly. And what this entails is that hormones are sent from your brain to your ovaries to release 1 or 2 eggs. Hormones from the ovary and from your brain are also sent to your womb, the lining of the womb, which we call the endometrium, to prepare for pregnancy. So just think about the hotel room, and you have the bed sheets, you have the blankets, you have all of this is what happens in the lining of your womb, with the intention that if fertilization occurs, that womb can carry a baby. So for women with PCOS, what happens is the first day of our cycle, the body recruits multiple eggs, maybe like say 10, 20 out of the numerous eggs that you were born with. But within a few days of your period, 1 or 2 dominant eggs, they kind of start to grow, and the other eggs feed that 1 or 2 egg until it's mature enough for you to ovulate. Now, for women that have polycystic ovarian syndrome, the food that was meant for that 1 or 2 eggs is being shared by like 20 children. So think about a meal portion for 1 or 2 children that 20 different eggs are consuming them. And this leads to, the eggs are not too small, like when they didn't have anything, but they are not big enough to be ovulated. Now, another unique thing about those half-grown immature follicles is that they begin to secrete those hormones that we see on our test, and we say the woman has hormonal imbalances. Now, because of it's the regular hormone that a woman should have, but they're in a different ratio than what is necessary, they also lead to, they stimulate the insulin resistance process that you talked about. Now, the first line of treatment that you hear us talk about a lot is lifestyle modification and weight loss. So like I said, polycystic is a multidisciplinary approach. Now, if you say metformin in itself, it's an insulin sensitizer that we use for diabetes. But I always say the first step in PCOS is usually the diagnosis. The insulin resistance, when we think about it, we just think about the diabetic component of it, not knowing that for a lot of women, their cholesterol is already high, their cardiac markers are already out of the normal range. So whenever we focus on just insulin, thinking about it as diabetes, we always feel metformin is the only insulin sensitizer that we can use. But we know that weight loss helps. We know that there are a combination of supplement protocols that are now being used to sensitize to have insulin sensitivity. Even in innovation now, different researches are ongoing to create a single pill that actually helps with all the various components that the insulin resistance may manifest with. But the weight loss does help. But if you're focusing on metformin and this woman already has dyslipidemia, already has cardiac issues, and you're not taking care of that, it's not going to reverse all those metabolic syndromes. So there's still a lot of research and protocols being developed around it.
Okay, thank you very much. My next question would be for both panelists. So I'll start with you, Dr. Usman. So the question is, we know that PCOS is a leading cause of infertility. What new fertility preservation options or treatment protocols are showing promise for women with PCOS who wish to conceive?
Thank you very much for that question. Okay, before I answer your question, just to add to what my colleague said earlier. So, like she said, research is ongoing to see how we can improve the sensitivity of insulin, you know, in those who are prone to having type 2 diabetes, as you have in those with PCOS. Myoinositol is one of the supplement that have been tried, and trials are still ongoing on this agent. either singly or in combination with metformin that she mentioned. Okay, to answer your question on how do we improve the chances of conception for those who have this condition. So unfortunately, like I said, it happens within the teenage years, early adulthood, or even sometimes advanced age, or during the perimenopausal symptoms. Age, depending on the variant of PCOS that the patient has, because there are various variants of this disease condition. Okay, traditionally what we do is that we use, like she said, the first line of management is a lifestyle modification. That can never be overemphasized. It can never be overemphasized. If there's something that we need to go home with today, is the fact that lifestyle modification is one of the key agents for managing this disease condition. Then you now go down to weight reduction, because we know the effect of androgen. Androgen is one of the factors that actually potentiate the progression of this disease, and then ultimately how it affects the hormones, the reproductive hormones, that helps us to have a regular HPO axis that will help us to ovulate and then menstruate as at when due. But because of this asynchronous activity that is potentiated by this high level of androgen affecting the reproductive hormones, you do not have that in those who have polycystic ovarian syndrome. So apart from the lifestyle modification, weight reduction that we have mentioned, and then the use of insulin sensitizers like metformin and the myoinositol that I've mentioned, practically what do we do at the fertility clinic? You must ensure that you rule out other causes of infertility. That is very, very key, because there are 1,000,001 reasons why a woman seated before you cannot achieve conception. Sometimes you may even have a dual effect, or dual reasons, or multiple reasons in one single individual. You may have PCOS, you may have tube blockage. So we must look beyond PCOS. So usually your fertility doctor will want to ensure and ascertain that he or she has ruled out other reasons why you are having challenges in achieving conception. That's very key. There are also differentials why a woman is having features that look so much like PCOS, what we call differential diagnosis. So it's also very pertinent for every doctor to rule that out before you, because it's actually a diagnosis of exclusion. It's actually a diagnosis of exclusion, because there are so many conditions that mimic the symptomatology of PCOS. So we have to ensure that we rule that out. So once we have ensured that other conditions, differential diagnosis have been ruled out, then we can now key in into what we call ovulation induction. So I'm assuming that, yes, we are very sure that the male factor infertility is out, other female factor infertility is out. So we start usually with ovulation induction. So wherein we give some medications to ensure that it will improve the chances of ovulation. The commonest and the first line agent that we use is clomiphene citrate. It's a selective estrogen receptor modulator, that helps to break the activity of very elevated estrogen in the body, which this disease condition has. There are other agents that are in use at the moment. Some people have preference for it, letrozole, which is an aromatase inhibitor. So what that does essentially is that it blocks the conversion of excess androgen to estrogen. So essentially, you are just trying to limit the estrogen level by using these agents. Sometimes we may have to progress to using even the gonadotropin, the hormones that is released from one of the higher centers that we mentioned earlier. So we give an exogenous dose of that hormone. And usually what that does is that it helps, to regulate and regularize the asynchronous hormonal milieu in patients or sufferers of this disease condition. I must mention that usually what we do is that we follow that up with serial scan to ensure that we track the follicles, because you also risk having a disease condition that we call ovarian hyperstimulation syndrome. So it's like you are trying to address one condition, but inadvertently you are causing another one. So usually we use just very low dose with follicular serial tracking to ensure that we have the right number of follicles, and then at the right time we can now either trigger and then ask for timed coitus. But what do we do now that is different? People have talked about laparoscopic ovarian drilling. That is not too very common in this time and age. Even wedge ovarian resection has also been mentioned as a form of increasing the sensitivity of the ovaries and then improving the chances of ovulation. ART is actually the key thing now, the assisted reproductive technology. There are various forms of it. So what I do is that for very young ladies, because unfortunately, as we all know, this is a disease condition that affects women within the reproductive age group. So it's like you are at the peak of your reproductive career. That is when you are supposed to be super fertile. And then you have these conditions that prevent you from releasing the eggs. So, unfortunately, you are menstruating, but you don't know that you are having what we call an ovulatory cycle. Yes, you are menstruating, but there is no egg within that cycle. And so more, you don't have the ability or increased chances of achieving conception. So what we do in ART is that we are able to take charge of this HPO axis. So we take charge of it by regularizing the amount of hormones that you release, by ensuring that we regulate when the eggs, how many of the eggs get to the mature stage. Because the hallmark of why you are having reproductive challenges as a sufferer of PCOS is because you don't have your eggs being recruited, like my colleague said. The eggs are supposed to get to the matured stage. But in your own case, the eggs don't get to that matured phase. So every cycle, you have immature eggs. So they keep waiting. Another crop of follicles gets recruited into the cycle. But unfortunately, again, this time around, they don't get to the mature stage. So in IVF or the ALT, we're able to give you some programmed medication that will help get this egg to matured stage. We also do what we call in vitro maturation. What we do is that one of the risks of doing IVF for those who have PCOS is ovarian hyperstimulation syndrome. And that can be very devastating. It can be a very severe complication for those who have PCOS and are going for IVF. But not to scare you, there are protocols. There are defined protocols for those who have PCOS and are going for IVF, what we call the freeze-all protocol. That is, we're able to ensure that we give you the right dose that will prevent you from having this ovarian hyperstimulation syndrome. And one of the ways of doing that is that we just freeze all the eggs and then use a different cycle entirely for embryo preparation and embryo transfer. So that it's like giving you room for relaxation. The hormone level comes down to normal level before the embryo is transferred, and then additionally improve the chances of implantation and then increase the pregnancy rate or the success rate of that IVF. Secondly, some people do what we call in vitro maturation. That is, you get the eggs at the immature phase. There's no problem. Because like we said, the problem with those who have PCOS is the fact that the eggs don't get to the mature phase. So we harvest them at that phase. And then we mature them in vitro. That means outside your body. And then inseminate before we now do the transfer. One other thing we can do now for those who have this condition, because you now have somebody who's very young, within her ripe, super fertile phase, having this condition, and then she's not ovulating, and then she's advancing in age, and then you are looking at the biological clock. This is like double injury. You are not ovulating, you are advancing in age, your biological clock is ticking. So what do? And you want to catch up with time. You don't want a situation whereby it's either you are even ready now, you are married, you are in a very good relationship, but you are not ovulating, and yet you are having issues. Or there's even a different scenario, you are not in the relationship, and then you know that you are not ovulating, but you are advancing in age. So what we advise is that you come for oocyte cryopreservation. So like I said, it's just the same thing. Just that the difference is that this time around, we're not going to inseminate the eggs. We just get the eggs out, either mature or immature. If it is mature, that is the full-blown IVF with the freeze-all protocol to reduce the risk or the chances of having ovarian hyperstimulation syndrome. Hello, I hope I'm not confusing you guys. Are we all together, please? Please, are we all together? Okay, okay. So, what we are trying to do is that we want to ensure that we are able to, because the thing is that it's not, unfortunately, like I said, there are various variants of this condition. There are women who have PCOS, they don't even know. Because they got into marriage, they got pregnant, delivered, 2 years later, got pregnant, so they don't even know. So it's not everybody that has this condition that necessarily have reproductive issues. It's not everybody. So we need to know that. But for those who have issues with ovulation or they have challenges with achieving conception, these are challenges. These are the ways by which we can actually help you. Thank you.
Thank you. Please, Dr. Leah.
Okay, so just to chime in that it's not every woman that has PCOS that has infertility or subfertility. We actually have women that have ovulatory PCOS where they see their period regularly and then they conceive. And I think one of the most unique thing about this conference is for us to shine more lights outside the reproductive part of PCOS, because a lot of women with PCOS do have something we call breakthrough ovulation, where they actually spontaneously ovulate, and if there's no other factor causing infertility and there's no male factor, they actually do conceive naturally. Now, just to buttress what my colleague has rightly said, the principle behind whatever protocol is being used to manage or to enhance your ability to conceive is to suppress multiple growths so that you can have 1 or 2 eggs growing, because that's all you need for conception. So either by the use of medications to stimulate ovulation or medications to suppress the growth, that the multiple growth that is going on at the same time, so that you can have the few ones you need to achieve conception. In some cases, which is what we've seen in practice, when a woman has PCOS and they are struggling to conceive, both the woman and her partner exclude all the potential causes of infertility. So that sort of causes a lot of time wasting where, so a woman has PCOS, but she already has diabetes. But because we've been doing only hormone profile, we're stimulating, but we all know that if the glucose level is not fully controlled, it's going to be difficult to achieve conception. So basically what we do in practice is to do a number of tests, because it's a spectrum. Just think about it. You could be at number 1 or 6, and the intervention that is most suitable for you is dependent on where you are on the spectrum. So for some people, it's basically just monitoring them, helping them to suppress the multiple growth so that they can have 1 or 2 breakthrough growths and they conceive on their own. We've had a lot of that. And we have some that we've tried that it didn't work. We have to use medications to help 1 or 2 grow more. And in some cases, there are combined factors responsible for their infertility. So it's sort of tailored to whatever the individual causes. But I will tell you that I've known a lot of women with PCOS that they had children. In fact, in between treatments, like while you're telling them to do weight loss, they're on this supplement, then they miss their period, like, okay, well, it did happen on its own. So it's not a one-size-fits-all, and it's not, PCOS is not an infertility sentence. It's just that it's one of the causes of infertility. But if you have a PCOS conqueror in this place, if you are not getting pregnant, don't take it as a sole responsibility of yourself or the disease condition that that's the only thing that may explain the delay in conception. Thank you.
Thank you very much. I'm just going to ask the next question to you as well. So many women with PCOS struggle with weight management. What's the latest understanding of the PCOS obesity connection? And are there any new interventions showcasing success in this area?
Okay, so let me go for you. Many women struggle with weight.
Yeah.
Let's remove the PCOS. Many women struggle with weight as we get older. Some women are lucky. We have some genetic magicians, so they can eat everything in the world, and then they just wouldn't have any weight. And there's some women that they just need to inhale food, the scent of the food, and they are adding weight. We know ourselves, clap for us. We know ourselves in this room. So, in itself, because PCOS happens in a woman's prime, the flip side that we don't focus on is that as we get older, our metabolism also slows down. So again, I begin to tell us that see, I've done a lot of diets. I'm an experiential. If you ask me keto, paleo, jalo, just think about everything you can think about. And I will tell you that I can tell the difference in my metabolism when I was in my second, third, and fourth decade. So again, a woman with PCOS should not center PCOS at the heart of everything, whether it's weight loss or whatever they are going through, because the natural progression with age slows down your metabolism. Now, in addition to that, you now have maybe other issues like the insulin resistance, the obesity. One of the things I do tell my clients that have living with PCOS is you have to give your body grace and time. When a woman that is not a sister has weight loss issues, they do 3 months. You know those lose 10 kg in 3 months flyers, like to crash it. You will do exactly the same thing that woman is doing, and your success is 1.5 kg. We know this. And this is because if you're being managed for PCOS and the extent of the metabolic involvement is not known and being treated, you won't lose the weight as fast as you should. So I always tell women with PCOS that, see, you have PCOS, have we checked your cholesterol? Do we even know, have we done ECG? Do we know the function? How is your heart function? How are your blood vessels? How is your sugar, your diabetes profile? How is cholesterol? Generally, that's one. Now we talk about the mood and the mental and the psychological impact of PCOS. We know that there's the role of comfort eating when you're stressed. Yep. So you talk about weight loss, and then someone that has had a terrible day, she's fatigued, she's been bleeding for months, and you want to tell her to hit the gym. She needs a cup of something nice to feel good. So it's like you're jogging, but by evening you're tired and you're eating. So it's not just straightforward that you say, you know what, go and lose weight and go back. We celebrate 0.5 kg in our center. When we see your scale move by 0.5 kg, it's like, girl, you are killing this weight, because we understand the interplay of your mental health, your psychological stress, the food you work. Nobody can. And what I'll tell you about weight loss is, you did not come to this life to lose weight. And we know that when you're trying to lose weight, it engrosses your whole life. You are doing meal plan, you are shopping, you're doing everything. So it's very hard for a woman that has PCOS already, that is dealing with the multiple problems. So this is why these communities are very important, because what they bring to weight management for us as specialists, apart from the fact, of course, we work with dietitians, nutritionists, those ones, they know how to combine foods that are not inflammatory, they suppress your hunger for longer. These communities help you to cope with the mental, psychological, and the alone feeling you get in your journey with PCOS. So for sisters here, we see you when you lose 0.5 kg, we celebrate it because we know that your journey is a bit different and it's more difficult than for women that don't have PCOS.
Thank you very much. I feel seen. Yeah. My next question is for Dr. Usman. So there's a growing interest in the role of inflammation in PCOS. Are there any new anti-inflammatory approaches being explored in PCOS management?
Yes. Like we said, it's a chronic inflammatory condition that spans right from the time that usually you attain menarche, that is the time you start menstruation, and then it goes on and on. The body is trying to respond, the body is trying to adjust, a whole lot of hormones are going haywire, the other ones are trying to correct it. So research is actually ongoing. Quite a number of research are ongoing. Some are actually cannot be generalized, meaning that because usually before you can actually say that yes, this is what you have come up with, and then it now becomes a norm or a practice that others should be able to inculcate or imbibe in the treatment of this disease or any disease entity. Usually it goes through some series of randomized control trials for it to be adjudged, to be suitable for use by everybody. So there still is it's a disease that has a whole lot, affects virtually every part of the body. So the thing is, everybody is trying to see how we can, first and foremost, manage what you have at the moment in terms of the symptoms, in terms of the metabolic response, in terms of the reproductive complications, and then the long-term sequelae. But in terms of the inflammation, there is no study for now to establish that, okay, this is the way we should go. But studies are actually ongoing. But it's just that most of them have not been randomized.
Thank you very much. So the next and final question for both our panelists would be to you, Dr. Leo, the first. So how do you see technology such as apps, wearables, or AI playing a role in PCOS management and treatment in the coming years?
So I always say that tech is an accelerator. The first thing I'll say in terms of even innovation before going to tech is one of the greatest learnings for me has been experience from clients, from women that have had PCOS. A lot of them have had to self-lead, and a lot of learnings are coming from them as per innovation. So it's some clients that come and tell me that, doctor, I use this, I use that, and I go and do like a deep dive into what they use. I'm like, okay, there's actually scientific backing for this. And then when the next client comes, I'm like, okay, this is what we use, this is what someone else used. I mean, can we tailor this and see how this works for you? Now, when you talk about tech, as basic as tech is, not even at the highfalutin level of app, is that tech gives you access to information. And I know that a lot of women that have had PCOS and they've really conquered it, they can tell you the role that having access to digital information played in them. For apps have been very critical in monitoring and in self-monitoring. If there's something we learned about COVID is that there are a lot of things you can do yourself, and quite a number of people are taking advantage of that. Anytime women sit across me in my office, and then I'm like, when was your last period? Can I bring out my Flow app? I'm always jealous of that app. Like, everybody brings out their phone and they're like, oh yes, I've seen my period, I'm 32 days, like 40-something days. So it helps tracking much more easily. Now, how can AI work? One of the things we've all spoken about here is that it's a disease that has diverse symptoms. But we know that the more women complain, bring in their symptoms, we can begin to sort of predict, because that's the role that AI actually plays in health tech for a lot of us, where when you have enough, when you feed it with machine learning, then we can now have, you can have a more effective predictive capacity. So if you have an app that has entered the symptoms of about 1,000 women that have had PCOS, it will start grouping them into, like, these are your symptoms, these are your responses, these have been most effective. So tech can be an accelerator for that. And of course, tech can be a community, just like here. A lot of women leverage, I mean, there are communities that have millions of women, shared experience, shared expertise. So women tell you that, oh yeah, this was where I went to, this is where I source my medications from, this is where I go to for care. So it sort of has like a multi-level playing field. And even for practitioners, while all of us are gynecologists and obstetricians, we all have niche that we'll focus on. So even these apps can also be like a registry where, because we know if we want to do IVF, you know where to go to. If you want to do this, you know where to go to. If you want to take care of your hormonal disorders, apps can actually say, okay, these are the best places for you to go to. But I mean, generally, I think tech has advanced access in every way, and is also helping us even as practitioners to stay connected with ourselves. Thank you.
Fantastic. Thank you very much. Same question
Okay.
to you, Dr.
Thank you very much for that. I think I'll just take off from where she landed. So it means that in as much as, yes, we're in the tech age, a lot of us here are super, how do I put it now, advanced when it comes to search engines and all that, you know, with all the gadgets that we have around us. So there's no doubting the fact that this AI's, the tech aspect, has really improved our knowledge and awareness of this, because just a click of it, you have a whole lot of information on this disease condition. But I also must sound a note of warning that for me, we really need to downplay the use of this, especially in this disease condition. Because this is a disease entity that you need a whole lot of workup as a doctor to be able to establish that this is what you are dealing with at that level. So that is being practical now, being practical. So that we do not use this app or over-rely on this technology, and then because it's a progressive disease. It's a progressive disease. The earlier it is diagnosed, the better. Because you are able to halt the progression. You are able to administer or get the right advice. There are a whole lot of conditions that you search on the web and then you get information. But some of those information can be misleading. So please, in as much as this, I'm not against it. In as much as this is very, very, very important, it helps us. We should also use it with wisdom and then still liaise with our doctor. Very, very important. Thank you.
Thank you. Do we have time for questions? No. Okay. So I'm just going to summarize and give key points of this session, if that's okay. So the first thing would be, please see your doctor, get your diagnosis to be sure exactly what you're dealing with, because you could be dealing with multiple factors and not just PCOS. It could be something else that's still, you know, it could be an offshoot or it could be something totally different. So the first thing is, please be sure that you get your diagnosis correct. Do not self-medicate. Do not get caught up on the web. I'm guilty. But please don't. Make sure that you actually are hearing the right thing so that you do not just protect your mental health pretty much, so you're not having anxiety over what really isn't even true. The next thing is to understand that there are multiple interventions that actually do exist. However, it still ties in line with the fact that you need to speak to a professional to actually guide you. And then another thing to note is that this group, what the PCOS conquerors are actually doing, this is where you should be. So please join the community. So you're speaking to people who have been through things. You could be new to this. It could be someone who's experienced it way longer. They would give you the support you need emotionally as well. Make sure you have the right information, and that's why you must be part of this sort of community to help you. Another thing to note is that while there are different interventions that exist, they would help guide you, the doctors, that is, would help guide you to the right one that suits what you're going through. And the final take is, you're not alone. We're in this together. We're experiencing it in diverse forms. I'm not going to go into the details because everyone has spoken all the different challenges that exist, but you are not alone. You are seen and you're a conqueror. So thank you very much to our speakers for such an informative session. Thank you.
Come on. See. One time, say.
Please, once again, a round of applause for them. Thank you so much, Dr. Yakubu Usman. Thank you so much, Dr. Abosede Lewu. And of course, the panel moderator, thank you so much, Mrs. Chidima Azike. And this has perfectly been summarized by the panel moderator. So what we'll do is, in the case that there is any question, because of our time, we can't take the questions as the panel sessions are on. But if there are any questions, please do also write them down and give it to any of the ushers, and we'll see how we can address the questions before we leave this place. Once again, thank you so much to our panelists. It was a very rich and insightful conversation on empowering health, innovative medical solutions for period problems, metabolic changes, and of course, infertility. Thank you so much. All right, very quickly, I want to ask a question. I see that we're very cold, so I just want to break the ice a little bit. So it's kind of a puzzle question, right? And if you know the answer, just echo it in the room, feel free. So the question is, you're running a race, and then you run past the person in the second position. What position will you be in? First? First? Second? Who's for first? I can hear first, but you're not raising your hand. Who's for first? Somebody said third. First. Okay. Second. Third. Okay, so who is bold enough to come tell us why they think is first and why they think is second? I need 2 people to come defend their answers. If you know you're confident enough. You're defending what? What? Second. Okay, so who is defending first? Nobody is coming out for first, but I saw hands raised. Okay, ladies and gentlemen, the answer is second position because you ran past the second, not the first. A round of applause for yourselves, please. Okay, so very quickly, here's another reminder on the program that you have with you. There is a puzzle behind it. And I did announce earlier that you should do well to fill it in because there will be a prize, there just might be a prize, for whoever gets all answers correctly. So during the course of the program, at some point, we're going to announce all the answers, and then we'll check yours and we'll announce the winners, right? So please, in your free time, do well to fill it so that we can see who wins it, who gets all the answers correctly. Okay, so on the next item of the agenda for today, we have a speaker, someone who is going to come out and speak to us on gut health and probiotics, right? And this person is fondly known as Winnie, and she is the founder of Zelicious Foods Company and the host of the Delicious Cooking series that airs on her YouTube channel and on My Naija Plate that airs on DSTV channel 173. You started clapping already. That means you have to continue till I'm done. As a proud citizen of the African continent, her passion to create mouth-watering Nigerian African-inspired delicacies has taken her and her audience on a tantalizing culinary journey since 2018. She's also extremely passionate about sharing etiquette tips that encourages her audience to live up to the right social standards for everyday living. I'm sure a lot of people will be like, you too do, but I mean, that's how we should be, basically, right? Through her online platform, Winnie School of Elegance, Winnie has a Bachelor of Science degree in economics from the University of Lagos. She quit a high-paying oil industry job in 2017 to pursue her dreams in the culinary industry. How many people can do that these days? I'm just saying. Now, today she has grown her brand from humble beginnings as a little YouTube channel with now hundreds of thousands of subscribers into a burgeoning media empire, working with highly seasoned professionals and some of the biggest multinational brands in the industry. And she now serves a global audience of over 3 million people with her fun and simple cooking tutorials of African and continental, I want to hear you clapping, recipes and her etiquette series. Ladies and gentlemen, to give this presentation as a brand ambassador for Mitch and Kay is none other than Winifred Wanya, aka Delicious Food, aka Winnie. Don't stop clapping till she gets here.
Hi everyone, good morning. It's such a pleasure to be here. And thank you for reading out my profile. And one thing you missed out is the fact that I am actually a nutritionist in training, which gives me the right to be here standing with you to talk about the gut health, and of course the role of probiotics in ensuring that you maintain a healthy gut health. Now, we've been hearing PCOS, a lot of people have talked about it. I personally first of all came in contact with the word PCOS about 3 years ago, and I was hearing it at different times, different intervals. I didn't really make any meaning to it until I met a dear friend. She's right here. Her name is Shefamaka. And I remember we were supposed to start a series on the conversation about PCOS, but we never got to it. Girl, we need to do it. And then we talked about it, and she explained in detail what PCOS was all about, and then she told me how she was also dealing with it and the process of her trying to overcome PCOS. This morning I learned, or rather, I've also learned that PCOS is something that cannot totally be overcome, but it's definitely something that you can manage to a large extent and actually produce results for you. You've also heard this morning from our experts who talked about that some people who have PCOS have actually gone ahead to have children, because a lot of people think that having PCOS is an infertility problem that leads to you not having children. But I personally have seen people, I've witnessed people who have PCOS and then have gone ahead to have children of their own. So like Dr. Abosede said, it's not an infertility sentence. You can have PCOS and still go ahead and have children. But today, I want to talk about the role of your gut in dealing and managing PCOS. Now, what is your gut health? What is gut? What is the gut? I don't know if you've ever heard about it, but I'm here to just give you a brief knowledge about what the gut is all about. I personally like to think or consider the gut as a powerhouse of the body. The gut is where a lot of things happen. It's like I consider it the second brain of the body. And what happens in the gut actually affects you not just physically, it also affects you mentally and can affect you emotionally as well. So what then is gut? What is the gut? The gut is simply the place where digestive operations take place. You see, when you put food into your mouth and then it goes into your belly, there's a digestive process that happens that where the food is broken down into your body, and then your body takes the nutrients that it requires and then takes out whatever is not needed as waste. All of that is happening in the gut. And the gut also contains something called the gut microbiome that actually has trillions and trillions of bacteria contained in it. So that is why it's absolutely very important that you are managing and ensuring that your gut is in healthy condition at all times. And how does your gut stay healthy at all times? It starts from what you put in your mouth. I'm very big on nutrition. I'm big on living a healthy lifestyle for a reason, because I believe that living a healthy lifestyle, especially with regards to eating healthy, is the make or break of a person. I look at our bodies as a material. I call it a system. And it's pretty much what you put in it is what your body gives to you. The creator of the body, I believe in God as the creator of the body. And I believe that when God created the body, he made it so perfect and excellent, and then gave us tools and materials that we should use to protect and guide and treat our body and ensure that our bodies are functioning for us at optimum level. The problem is that a lot of people haven't yet come to understand the importance of using these God-given materials to ensure that we keep our bodies in check. And then, as we continue to advance in age and we continue to advance in society, there's lots and lots and lots and lots of things that work against us eating the right things, consuming the right things, and putting the right things in our bodies. Everywhere you turn, there's something telling you, girl, for example, you walk on the streets, you see the abokis selling the natural fruits and vegetables, right? And then you turn and then you see, I'm not going to mention a brand name, you see a processed food company selling all the processed foods that have the very high cholesterol and gives you a lot of, raises your blood sugar levels and just makes you sick, literally gives you a headache. You see someone who has the option of who has the option of a bottle of water and the option of a fizzy drink, and the person reaches for the fizzy drink instead of taking the natural water that God has already provided. So God gave us this body for a reason, and when he made the body so perfect, and then gave us the materials that we should use to take care of the body. So materials like the natural foods that we eat, but then people have now decided, or a lot of people have decided, that they're going to go the other way around, and that's where a lot of these problems now come into place. And whatever it is that you put in your body actually affects your gut. And again, like I said, your gut is the powerhouse of your body. It's literally your second brain. What happens in the gut affects you physically, mentally, emotionally, in every way. So you need to start being very mindful of the foods that you consume, what you eat, when you eat, how you eat, because I tell you, it affects you. Your body is pretty much garbage in, garbage out. What you put in it is what your body is going to give to you. When you feel a headache, for example, you shouldn't start going up. I'm not very big on medications. I'm big on taking the natural remedies to taking care of my body and ensuring that I keep my body in tip-top shape. So for example, when I feel a headache, the first thing that comes to my mind is not to go take a pill or paracetamol or Panadol pill. First of all, I ask myself, am I dehydrated? Am I thirsty? Have I gotten enough sleep? Have I exposed my eyes to light, too much light? Have I stared at my screen so long? What is causing this headache? There must be a root cause. So instead of popping a pill, I ask myself, what may be causing this headache naturally? And then I go remedy it by choosing a natural solution. Pretty much, that is what your gut, that's what your gut is all about. What you feed into your body is what your body is going to give to you. So now you may be asking, how is the gut connected to PCOS? Now it's connected in so many ways. But the one major way, and I'm sure you've heard some of the experts talk about it, is something I like to call insulin resistance. Now, insulin resistance is a pretty simple term, and I'm going to try as much as possible to break it down to the very, like I'm talking to, pardon me, but I'll say like I'm talking to 5-year-olds, because sometimes the concept gets very complicated and people don't actually end up understanding it. But what is insulin resistance in very simple terms? So you see, when you eat food, when you consume food, right, the food you eat, every single thing that you eat and put into your mouth somehow turns into a form of sugar in your body. Anything, think about it, whatever you eat ends up turning into glucose in your body. So when you eat whatever it is that you eat, always remember, it is turning into a form of glucose or a form of sugar in my body. The fastest group of food that turns very quickly to sugar is the class of food called carbohydrates. I'm sure a lot of you have heard, stay away from your carbs, stay away from your carbs. Well, I'm not here to advise you to stay away from your carbs, because carbs are very essential for the body. But the fastest group of food that turns the quickest to sugar are carbohydrates. And I will focus so much on simple carbohydrates. Simple carbohydrates you get from overly eating processed foods, things that don't have any form of fiber, dietary fiber in them. So those are what I like to call simple carbs. When you put in the simple carbs in your body, for example, you wake up in the morning and choose to take 4 or 5 slices of bread with pap. Damn. You are hurting yourself so terribly. Now what happens is this. As soon as you consume the bread and the glucose into your body, immediately it is converted to sugar. So as you're consuming bread and pap, for example, think about, just imagine that you're taking maybe 10 cubes of sugar. You might as well just go and take 10 cubes of sugar if you decide to take bread and pap, because your body converts it to sugar really quickly. Now, what happens when you take the bread and the pap in the morning? Your body converts it to sugar, right? Now, your insulin gets activated. There's an hormone called insulin in the body that gets activated and then tries to push this sugar or glucose that you've consumed into your cell to provide your body with the energy that it's required, right? Now, when your cell knows the amount of energy it needs per time. When your cell has had enough of the energy, right, it shuts off the insulin from doing its work. It tells the insulin, guys, I've had enough, please, stop pumping me with what? Energy. That's when insulin resistance happens. And at that moment, what happens? The insulin now goes into action and tries so hard to prevent this excess sugar that you have consumed from going into your bloodstream. Because when it goes into your bloodstream, that's where you have all of these diseases starting to happen in your body. Things like diabetes, things like you start to have like very chronic, terrible illnesses. So the insulin activates itself and says, no, I'm not going to push all of this blood into the bloodstream. And then now starts to divert all this sugar and energy into other parts of your body. That's where you have things like, you start to have excess weight around your tummy, you start to experience like very terrible, your liver starts to become very fatty because now the insulin is pushing the fats to your liver. A lot of problems now start to happen. And all of that problem is happening where? In the guts. So that's how insulin the gut and PCOS are linked through this thing called insulin resistance. When your body is in insulin resistance mode, it is absolutely dangerous, especially if you are a person who has PCOS. Because your diet, you've heard them say that your diet and your lifestyle changes is actually very important in helping you combat this thing called PCOS. So when you, as a person with PCOS, is insulin resistance, it becomes severe and very difficult for you to manage the problem. In fact, you are adding to the problem and not subtracting. And again, remember, like I said, this whole process starts from what you choose to put in your mouth. What are you putting in your mouth every day? What goes into your mouth every morning when you wake up? When we started this, I work for a brand, and then there's this concept that there's this tagline that we use called Eat for Good. So Eat for Good is pretty much eating the right things that your body requires to function and can help you thrive through not just the day, but throughout your life. So a lot of people, unfortunately, in this part of the world, we were brought up in society where we didn't know so much about nutrition. My mom came to me, I think about 1 year ago, and she was talking to me about how I have helped, because she was diagnosed with diabetes. And I remember when she was diagnosed with it, it was like her world came to an end, because all the things she likes to eat, she had to stop eating. But thankfully, I had already started studying nutrition, and then I helped her manage the situation and still found a way to include the things that she would love, but this time in a healthier manner. And so throughout that process, I remember she came to me one day and she said, she really thanked me for the knowledge that I was able to amass with this nutrition, because if I had continued the way she taught me to eat, things would have been bad. There was a time in my life where I was also pre-diabetic. Yes, and I knew, even though I didn't go to the doctors for any diagnosis, I have learned how to read my body. I knew I was pre-diabetic because I had very blurry vision. I had severe, terrible chronic headaches. I would eat things like, for example, we eat popcorn, we say, oh, it's just popcorn, we're just snacking. I tell you, 2 cups of cooked popcorn that you probably will go to the cinema, buy a whole pack of it. Just about two hefty cups of it contains about 900 calories. And corn is sugar. Again, remember, it's carbohydrates, and it is sugar. And then when they are making this corn, they make it with what? Sugar. Thank you. So you see where the problem is? You see where the problem is? So we developed this concept called Eat for Good. And eating for good is pretty much you paying so careful attention to the things that you put in your mouth, so that your body, this body that God has so generously blessed you with, can actually help you thrive and do the work that God has called you to do on earth. But if you are not paying attention to the things that you eat, the food that you eat, that's when you start to have all of these problems occurring. And then, of course, for example, we are here because of PCOS. Now you have this PCOS, you've been diagnosed with PCOS. It's now very vital that you start to make these necessary dietary changes so that you are able to combat this syndrome that has now come on your body. With food, you can literally change your entire life. Now I'm here on a brand ambassador duty for Mitch and K Greek yogurt, right? So now you might be wondering, okay, how is Mitch and K connected to the gut health, and how is it connected to PCOS? I was having a conversation. I invited Chef Amaka to the couch, on my couch, and we're talking about PCOS, because I'm actually very, I'm actually very passionate about PCOS now, and I have followed her journey. She's one person who inspires me so much. And we're having the conversation about PCOS, and towards the end of the conversation, we brought up the talk about Greek yogurt, right? And she talked about how Greek yogurt is literally the cheat meal for anyone who has PCOS and likes to indulge. That's the word. So yeah, how is it linked up? Now this is where I'm going to come talk about some key factors to helping you maintain good gut health. After saying everything I've said, what are the things that I can do, Winifred, to help me ensure that my gut health is in good condition? I have put down a couple of things. The very first one, of course, would be for you to enjoy a wide range of prebiotics and probiotic-rich foods. Now, what are prebiotics and probiotic? What is prebiotic and probiotic? Like I said before, your gut contains thousands and thousands of bacteria, both good and bad, right? The prebiotics actually help you ensure that the good bacteria, these good bacteria are very, when you hear bacteria, don't think about it as a negative thing, it's a positive thing. So the good bacteria actually help promote good gut health. I don't want to go into the technicality of things so that I don't confuse everyone. But just know that the good bacteria promotes the health of the gut, and the bad ones actually shatter and disrupt the health of the gut. So you want to be focusing on ensuring that you're taking prebiotics, which actually enhances the work of the good bacteria. So it's like you taking, as a human being, taking a lot of water to stay hydrated. That's the work of the prebiotics. And you can get, people say take your prebiotic supplements, but because I go natural, I look for foods that actually have, the prebiotic, what's it called? Thank you. She said the prebiotic component. So you look for foods like oats, foods like cabbage, foods like, I put down a couple of them on my notes. Let me just quickly get them out. And I always say that you do your research. Like, this information are actually available on the internet. And I always also advise that people take a basic course in nutrition, because it would actually help. These are things that you're not taught in school, but your body and your human self actually requires this information in high amounts. So it's important that you do your basic search on just what you call basic nutrition. You don't have to go get a degree for it, but it's important so that you know exactly the foods and the things that you're consuming and how it can actually help to hamper with the growth of your body system. So food produce like, let me just quickly pull out my notes, please. So I talked about things like oats, nuts, you have your cashews, your almonds, your peanuts. Those things actually contain prebiotic supplements. And then you also have things like your cabbage. So if you sometimes people say taking the supplements is actually way better, especially people who really don't like to consume healthy foods. But because I'm very big on eating healthy, I'd rather go the way and the direction of taking these things from the natural sources. So like I said, what you need to do is just go on the internet, look for the food sources, especially the ones that are readily available in Nigeria, and find ways to inculcate these ingredients into your diet. But again, the supplements are not bad. I'd still take my probiotic supplement, not the pre one now. I take the pro, but you can take your pre and your probiotic supplements, but I would advise that you consult your doctor to be sure that you're taking the right ones, especially if you have a condition like the PCOS syndrome that you may be managing. So that's that for the prebiotics, which actually enhance the well-being of the bacteria, the good bacteria in your gut. There is another one called the probiotics. Now, the probiotics are the ones that the gut actually needs to function. So it's not the pre. Remember, the pre one is enhancing the work of the bacteria. The pro ones are what the gut now needs to function. And you can get your probiotics from fermented foods. And that's where Mitch and Kay comes into play, where you have your things like your kimchi. If you've ever heard of things like kimchi, even kunu, things like kunu in this part of the world is fermented and actually has lots of probiotics in it. I also say anything that is pickled cucumbers, pickled ginger, pickled onions, anything that pickled cabbage, yes, they call it sauerkraut, right? Yes, pickled cabbage, anything that is pickled or has gone through a fermentation process is very rich in probiotics. Now, this is where Mitch and Kay comes into play. Greek yogurt, like we all know naturally, is fermented milk. Okay, let me not go through the process of making Greek yogurt, but it's a very pretty process. And it actually requires for this milk to stay in a particular place for a long period of time, going through or undergoing a fermentation process. And like Chef Hamaka told me, which I already know, Greek yogurt is actually a cheat meal for anyone who is looking to live and maintain a healthy lifestyle, not even anyone who is dealing with the PCOS syndrome. So if you're looking to maintain a healthy lifestyle and you like to eat and consume a lot of food, make Greek yogurt your best friend. When I wake up, or rather when I'm awake at 9 p.m. or 10 p.m., and this mouse doesn't want to stay put or quiet, what I do, I always do this. If you come to my fridge, I'm the brand ambassador for Michanke, so I should have Michanke in my fridge, right? So I have tubs and tubs of Michanke in my fridge. And something else I also have is something I call soaked chia seeds. So what I do when I feel peckish at night is I just mix my Greek yogurt with my soaked chia seeds and add some berries on top with some nuts. That for me would literally, as soon as I'm done taking it, the cravings have been satisfied, I am full, now I can go to bed. And this is actually a cheat meal that doesn't do any rubbish to your guts. Instead, it enhances the gut health. So it's important that you're adding lots of prebiotics and probiotic-rich meals to your diet. Second thing is, of course, I'm here for Michanke, but I would also give you some of the other tips that can help you enhance your gut health before I wrap up quickly. The second one, still under the dietary factors, is for you to ensure that you're eating a balanced diet that contains components like dietary fiber. Again, I talked about carbohydrates earlier. You need to be focusing your attention on eating complex carbohydrates and not simple ones. The simple ones get broken down in the body quickly because they don't have anything like dietary fiber and other nutrients in them. But the complex carbohydrates have dietary fiber, they have all the nutrients that can actually slow the process of conversion into sugar it slows it down very much, so it won't just convert it to sugar. So things like your oats. Oats is a beautiful thing to enjoy, for example, as your breakfast in the morning. So you want to ensure that you are avoiding simple carbohydrates and focusing on complex carbohydrates. So have a balanced diet. Your plate should always include things like vegetable. One trick I would give you that I do for myself personally is, before I eat any meal, I always ensure that I put in some form of vegetables in my belly. Now, vegetables contain a high amount of fiber, so that when I'm eating whatever it is that I'm eating, the vegetables act as a shield and a guide, and it doesn't transform. Even if I decide to eat the carbohydrate, it doesn't transform it so quickly. It disrupts the process of transformation into sugar. It stops it and slows it down to a large extent. So the second point under the dietary factor is ensure that you're eating a balanced diet. Fiber-rich foods that have fruits, vegetables, legumes, whole grains, just to ensure that you're nourishing the good bacteria in your gut, okay? Third one is, of course, limit sugar and processed foods. Anything that has sugar in it, please, I beg, turn your back on it and say, I'm not interested, because sugar is toxic to the body. Sugar is toxic to the body. If there's nothing you take from me today, take this one word. Sugar is so toxic to the body, and you should avoid it at all costs. And then, of course, the final one under dietary factors will be for you to ensure that you stay very well hydrated. Drink your water. And, of course, under this point, I would also say ensure that you're supplementing your water intake with some electrolytes, so you're not diluting the electrolytes in your body. That's conversation for another day. Then under the lifestyle factors, I would say I'll talk about regular exercising. Ensure that you're managing your stress. Women go through a lot. We go through a lot mentally, physically, emotionally. We're going through a lot on a daily. But ensure that you're managing your stress to a large extent. And then finally, of course, get adequate sleep. Stop playing with your sleep, I beg. Stop playing with your sleep. Ensure that you're getting at least 6 to 7 hours of quality sleep every day, so that your body has the ability to rejuvenate itself. And then, of course, the final thing I'm going to talk about here before I leave is, I think Dr. Abostede was the one who mentioned it. She talked about forming a community, finding a community of healthy minds, a community of people who think the same way, and then joining that community because it actually helps you, it keeps you encouraged, it keeps you motivated. I know that Chef Amaka has one. Amaka, am I right? She has a community of people who are dealing with this PCOS thing, and then I see their conversations. I see how they have very thriving conversations on that community. So find a community that actually helps you and stay encouraged and stay the course as you're dealing with or going through this thing called PCOS. And yes, my prayer for anyone who is dealing with it, who is dealing with the psychological, emotional, mental, or even the physical effects of it, is that you would overcome it in Jesus' name. Amen. Thank you so much.
Ladies and gentlemen, once again, please, a round of applause for Winifred Nwanya, the brand ambassador, Mitch and Kay, aka Zilicious. Now, she not only helps us stay demure and cutesy or whatever it is they say these days, but she also helps us know what to put in our bodies. Have we learned anything? Okay, so the people that did not answer are the bread and pap community. So I'm not talking to you, I'm talking to those that have learned. Have we learned anything? Good. All right, thank you so much. Please, once again, put your hands together for Winifred Nwanya. All right, very quickly, we'll be going to the next item on the agenda, and then it's a presentation from someone who we very well know and love. And of course, right after the presentation, there will be a video, a documentary video that is played. Now, this next presentation is from a speaker who is an on-air personality, a TV presenter, an actress, a founder, the founder of the NGO, The Future Is Her. I'm sure some people already know who I'm talking about, but if you don't, I'll still go on. She's also the executive producer of the documentary, Where the Heck Is My Period. She's an insightful, the documentary is an insightful documentary that is live on Amazon Prime Video. And let me tell you, that is the first licensed documentary in Nigeria. You may not know who I'm talking about, but you should stop clapping by now, because it's not an easy feat, okay? And this documentary basically shines a light on the struggles and the experiences of women living with polycystic ovary syndrome. Ladies and gentlemen, I'm talking about none other than Stephanie Koka Aderinoko. She will be addressing us shortly, and then right after, the documentary will be played. Please focus your attention on the screen.
Hey sisters, I am so honored to be speaking to you all today. I'm actually really sad that I'm not there in person, but I know that this event is going to be so amazing and you're going to take away so much knowledge from it. PCOS Conquerors is a really dear project to me. I love the organization. I love Shay so much because she was such a big part of the Where the Heck Is My Period documentary story, and I'm just glad that this event is happening. But yeah, again, I'm really sad that I'm missing it. As you may know, or most of you know, I am a big advocate when it comes to PCOS. I myself have polycystic ovarian syndrome. I've known since I was a teenager, and I've always vowed that one day I would share my story and also use my platform to help other young women. And I'm just glad that Where the Heck Is My Period is out now. I just want to say that, you know, any of you that have PCOS or think you might have PCOS, it is not a death sentence. It is really not what you think. But the earlier you start to change your lifestyle habits and think of ways in which you want to heal your body in a way, because PCOS can really take over your mental health, your emotional, and it's really about what you're giving your body. It is not something that needs to hinder you. I just want to let you know that you can do everything that every other woman can do. You literally just need to understand that it's all about lifestyle changes, it's all about your diet, it's about working out, and it's really about just being positive. PCOS is something that has taken over my life though, I can't lie, and I'm sure those of you who have PCOS know exactly what I mean, but I am able to persevere because of all of you sisters, because when I think about some days where I'm like, I don't feel like I'm in the mood, I think about the 1 in 10 women living with this across the globe who are kicking it. They're kicking ass, they're smashing ceilings, they're doing so much with themselves, and yeah, I just want to give you guys hope. I pray that I'm inspiring you with the documentary, and I hope PCOS Conquerors are also inspiring you. And yeah, you don't understand how sad I am. I'm missing this, but I'm happy that I'm able to, talk to you guys virtually. I hope you guys enjoyed the event or have a great time. And make sure you watch When Heaven's in My Period if you haven't. Remember, it's streaming on Amazon Prime. And yeah, thank you so much. I'm so honored, and I'm also really honored for the award as well. Thank you, Shay, and thank you to the whole PCOS Conference team. Mwah. Love y'all.
Diagnosed with PCOS officially in 2017. There was just that sense of, okay, this is there, but I didn't necessarily pay attention to what was officially in 2017. There was just that sense of, okay, this is there, but I didn't necessarily pay attention to what was going on until my body forced me to pay attention. There was just that sense of, okay, this is there, but I didn't necessarily pay attention to what was going on until my body forced me to pay attention.
Every doctor wants to do hormonal AC. After they have seen it, they want to see it, they want to do it again. And things are not easy. I gave up.
I had it once, but it was basically, it could be PCOS.
I went to the hospital and they first carried out the normal pregnancy test. It showed negative. They gave me some things to control the headache and the thirst.
I didn't go to the hospital because of PCOS. I went to the hospital because I didn't get pregnant.
So the doctor now said, okay, after what it says, he now said, oh, he's a gynecologist. So he now said, you have, he didn't even say I have PCOS, funny enough. He never said I have PCOS. He said the male hormone is higher than the female hormone in your body. I was like, am I a man? I left there more confused than when I came. So he now said, I'll prescribe birth control for you.
So I had to go to a general hospital. I could remember that experience actually. And when I went there, the doctor asked me to do some tests, the ammonia test, that was what she called it.
And he looked at me and said, because you are fat.
When I got diagnosed in 2017, I told my husband because we share everything. So told him about it, and we just prayed. And I mean, for him, his own main concern was, okay, if the weight thing is an issue, then let's see how we can bring it down.
So the first doctor I saw said I should stop having sex because I may get pregnant. And then I should go and lose weight. I was barely 75 kg.
So I went for the transvaginal vaginal ultrasound, and the lady was like, oh yeah, I can see some cysts. Vaginal ultrasound, and the lady was like, oh yeah, I can see some cysts on your ovaries. And I said, okay. And she said, yeah, you might. And I said, okay. And she said, yeah, you might have PCOS, but I'm gonna send the information back to your GP. So that's my general practitioner, and I went back to meet her, and she confirmed, yes, you have PCOS. General practitioner, and I went back to meet her, and she confirmed, yes, you have PCOS.
I now put it in my secondary school group chat. Oh, please, that I'm having acne, blah blah blah. Mercy, that is any doctor here that I can speak with? So one of my colleagues now called me on. One of my friends now called me on the phone. I was like, okay, I should tell her my symptoms. It was not the first person that said, do you know PCOS, that it is most likely that you have? Said, do you know PCOS, that it is most likely that you have PCOS?
I think the first time I actually encountered the word was I went to a GP in England, and they basically just put me on the pill.
You have PCOS, I can see, because you are fat. And I was like,
lose weight. I don't even know what my issue is. Can you just explain? Let me know what the root cause is. Is it genetic? Is it hereditary? How did I get it?
I think that was when depression set in as one of my mental symptoms. Because I looked at him, I was like, how can you say that?
The fact that I was told that I had PCOS, but just the symptoms, I didn't realize they were even associated with the condition. I wasn't ready to give birth, so, you know, most doctors would just say, oh, when you're ready, they know what to do, come back then.
Whenever I'm ready to give birth, that should come back. And that I should take relationship very serious, that I should get married early so that I can give birth.
And after the test, the question, I think I was a bit older but not married. And the question she asked me is, you are not married? Yes. I think you should get married soon. And I was like, okay, what happened?
My GP's explanation of PCOS to me was quite detailed. I think she even went on the internet. Yeah, she did. She went on the internet and showed me like, okay, yeah, this is what polycystic ovarian syndrome is. She did say it's nothing to really be worried about. She just said something about kids. She said it won't stop you from having kids, but it will just make it a bit harder. That's what she said.
I remember getting home and I was crying. And I felt like, because I eat too much, because I take too much of sugars, because of this, that.
The doctors didn't really help me. I helped myself.
If you're clapping, then you can do better than that. That was a very detailed and very insightful, once again, a very detailed and insightful documentary. I think we've seen 2 documentaries now, and by now, if you had no idea what PCOS was when you entered here, I'm sure that at least you have some information now that you can work with. And again, we're grateful to the organizers for that. Very quickly, we'll go on a short video breather. And then you can take this opportunity to stretch your legs, network, talk to anybody that you haven't talked to before. But more importantly, to your right and to my left, there is a clinic just outside the hall where you can get free body massage. And you can also do a free blood pressure check. And of course, you can do a free scan. And most importantly, you can get your PCOS test done. So please, right after the video plays, you can step outside, do whatever scan test you want to do. That will take about 10 minutes. And please do well to network and connect with someone. And then we'll come back to continue the program. So in the meantime, please focus your attention on the screen. And right after, feel free to step out and get your body massage, your scan, your blood pressure checked. Thank you.
In 2019, we embarked on a journey to craft the most delicious Greek yogurt filled with a healthy source of calcium. And we found the perfect one, Mitch & K Greek Yogurt. We started off in the city of Lagos and rose to become the perfect Greek yogurt the city had ever tasted. But like a shining light that can never be hidden, Lagos could no longer hold us to herself. The contagious, nutritious excitement has now spread to over 200 stores across 14 states. Guess what? Our commitment remains to consistently delight our customers with our great tasting Mitch & K Greek yogurt as we expand our reach to that neighborhood store near you. Mitch & K Greek yogurt, perfect in every scoop. Refrigeration magic. When Mitch & K yogurt is stored in a refrigerator at the appropriate temperature, its consistency remains creamy and yummy. Just the perfect texture for your taste buds. Frozen pleasures meet thawed surprises. We love that some people also enjoy the icy frozen consistency of Mitch & K yogurt fresh out of the freezer. However, when thawed, the ice crystals that form during the frozen state can change its creamy consistency. To indulge in a perfectly creamy Mitch & K yogurt, refrigerate for perfection.
PCOS conqueror. After suffering for 15 years when I was diagnosed when I was 16, I've managed to lose over 40 kilograms, got my cycles back, cleared my skin, and now live a very happy, healthy, PCOS-free life. Because of the journey, I actually started a business called It's a PCOS Party to help other women really overcome PCOS, reverse the condition naturally through diet and lifestyle alone, and to understand that you still can enjoy life, you can party, you can go out, and the condition does not have to define you. You can find me on Instagram at It's a PCOS Party, where I share every day lots of different tips to help you with your symptoms and to really help you navigate through the issues surrounding PCOS. I am certainly a PCOS conqueror, and I really hope to empower and inspire other women that you can do the same, you can reverse PCOS, you can manage your symptoms and live a really happy, healthy life.
Ladies and gentlemen, at this point, feel free to stretch your legs, feel free to step outside, and then don't forget that there is a clinic just outside by your right to my left where you can get your free body massage, and of course, you can get your blood pressure checked for free, you can get your weight checked for free, and you can get your scan done discounted. Please, the scan is at a discounted price, but your massage, pressure, blood pressure, and weight, you can get it done for free. Thank you so much. We'll be back here in about 5 minutes to continue the program. So don't forget to network, connect, meet someone new that you haven't spoken to today. Thank you very much and see you shortly.
àlàyé mi bá mi sọ̀rọ̀ kan kí ló ń lọ. Wọ́n máa rí ìyàwó rẹ̀ mi lọ ń sọ. Wọ́n ní mo give them pressure. Ìjẹ́ má lọ sùn ṣiṣẹ́ lọ, ọmọ ìyàpá ó lọ. Nobody go dey when sapa don too much. Ẹni tó bá bá aṣọ òṣà ló mọ̀. Kàbókàbó lọ, ọmọ bá ṣì ń lọ. Ìsídèlé kan ìsídè ọ̀. Happiness, everythingness. My life no stress. Fine boy no ex. Happiness, everythingness. My life no stress. Òtútù, ó wáyọ̀. Bákàrà sí mi alákọ̀ọ́lẹ̀. Ohun tó ń ṣe yín kọ́ ló ń ṣe mí. Ẹjẹ́ lọ mọ̀ tá ń ṣe àníbi novice. Yépa, yépo, àṣàmọ̀dì. Ọ̀gá no dey form of wasabi. Michael Scoville, as you can see. Àbí zombies, ó kàn mí o. Òtútù, ó wáyọ̀. Bákàrà sí mi alákọ̀ọ́lẹ̀. Ohun tó ń ṣe yín kọ́ ló ń ṣe mí. Ẹjẹ́ lọ mọ̀ tá ń ṣe àníbi novice. Yépa, yépo, àṣàmọ̀dì. Ọ̀gá no dey form of wasabi. Michael Scoville, as you can see. Àbí zombies,
Girl, I promise, oh yeah, I promise to always be there. Even when you mess up, yeah. Now me go still tell you no vex. I go give you respect, the respect I give my mama. You say make I give you pretty, make I give you jelly. Sissy, you're beautiful from head to toe. Sissy, you're beautiful from head to toe. Baby, jump. You got a pretty face, yeah. You got a pretty body, yeah. But then you never gonna allow me, touch. You way too free, my honey. You way too free. I know that you don't ever
Cool DJ B on the wheels of steel.
My past, all of the girls who did it out. And I know what I feel. I hope that you feel the same for me. Share. You go come to my place. I need you in my space, oh. I want you in my space, oh. Share. I just want to see your face. Don't mind if you delay, oh. I just know that I don't wanna be lonely tonight. I don't wanna be lonely tonight. I don't wanna be lonely tonight. I don't wanna be lonely tonight.
Money on my mind. Care what they yarning about me in particular. Call me. Out here on the road chasing my dream because I know I'm chasing for me. Ololola de mango molo. Orokota idisho molo. If you want to let Jack come alone, you find anybody na money I want. But they hear what the people they do. Want to get a shakeleti love. It's a love and I want to get another one. I go take and do it in I love. Waiting you love. I be waiting I love. Waiting I love. I go do it without my heart. Go be vodka. Mr. Money Changer. But when I know I know the ways that Mr. Money Changer. Just carry on, give me no time. Bad boy day, me I day fine. And at the same time, me I day high. Motor stand out, calm down, you go day fine. Like fine wine, no decline. Sing about it, extraordinary things. Show me love, I go show you more. Go sheshe, ọmọ yìí don deja, ṣe délé mú fọ́ fàyè, yeah. Ọlọ́ládé máa ń gbọ́mọ lọ, ọ̀rọ̀ kọ̀tọ̀ ìdí ṣọ́mọ lọ. Ẹ fi wọ́n sílẹ̀ jẹ́ kó máa lọ, no dey find anybody na money I want. But they hear wetin people dey do, wọ́n ti gbé àṣà kẹ́lẹ́tì lọ. Ìsìn love and I wanna get another one, I go take and do wetin I want. Wetin you love, oh, baby, wetin I love, oh. Wetin I love, I go do am without my heart. so clean. Love me in and out, unfailingly. And I'll be down now. Anytime you call me, I'll be down. I'll be down. Because I love and I love and I love and I love you only. Because I need and I need and I need and I need you more. Yeah, you know I run and I run and I run and I run. Fly, we can fly in the sky in the night. Hold me in your arms and your love and your light. I'm on your wave right now. I'm on your wave right now. Yeah. I'm on your vibe now. You got me on your side now. Yeah, I'm on your wave right now. Yeah. If not you, then I don't wanna know. I don't want no story. Day and night, it's unconditional. Got me living softly. Yeah, yeah. Don't me judge it. Don't me tender. You know you love turn me up like never. Anything you want and I'ma do whatever. Because I love and I love and I love and I love you only. Because I need and I need and I need and I need you more. Yeah, you know I run and I run and I run and I run. Fly, fly in the sky in the night. Hold me in your arms and your love and your life. I'm on your wave right now. I'm on your wave right now. Yeah. I'm on your side now. You got me on your side now. Yeah, I'm on your wave right now. Said I need you in the morning, but I need you now. Yeah, yeah. I find you, I give you all you needing. I know what you like. You don't need no other body. You don't need no other body. Only you feel on my body. Only you feel on my body. You don't need no other body.
Say I me the mess up in mind, and I me the make you free up your mind. Say your body talk to me nice. Say now my love you didn't need for your life. Yeah, I love no be lie. Say every day together, yeah, day and night. Yeah, if I leave you go by. Yeah, if you leave I go stroking your body, baby. Loving your body, baby. As you're whining your body, baby. So crazy. Loving your body, baby. Girl, you want need to me. I just wanna let you know. Hope every day
You don't need no other body. You don't need no other body. Only you feel on my body. Only you feel on my body. I prayed for this moment. I would be by your side. And I don't wanna forget.
Hold the jelly on the wheels of steel.
Girl, I just want me with rock. Girl, I just want me with vibe. Girl, I just want me with you like ice water. Me, mama, she be body. Be spend you my paper. After tonight, I go like to see you later. Pass on a vendetta. Against me, cause of you, I got many haters. I'm a girl, fine for your guy. Baby, wait till you define for your life. Man of fair broke, nigga, fight for your life. Roll with me, make I blow your ass up like Marilyn Monroe, you to set. Every man wants to open bonnet. No figgy, but they want to collect. Better guys, that's like a cassette. Mama let, don't you forget. Me, I be cocky, but now I depress. I don't default, baby to get. Bakasi causing domino effect. You don't need to introduce to yourself. Michael Jackson, thriller, you are better. If I say you for that, I feel tell. The way your body take it, the bend. Girl, I just want me with rock. Girl, I just want me with vibe. Girl, I just want me with you like ice water. Me, mama, she be body. Be spend you my paper. After tonight, I go like to see you later. Pass on a vendetta. Against me, cause of you, I got many haters. Yeah, grab something, oh something. Like it's your birthday, go shawty. My worry. Nobody fit to take your place, baby, shake something. Them no feel like better for mosquito. Beef them, get for me, pass it 1 kilo. Come on, eyes on the price of my baby, you. Want to take to your papa, na do you. Mama let, don't you forget. Me, I be cocky, but now I dey pressure. I don't default, baby to get. Kakasi cousin, domino effect. You don't need to introduce to yourself. Michael Jackson, thriller, you are better. If I say you for dark, I feel tell. The way your body take you, the bend. Girl, I just want me rock. Girl, I just want me vibe. Girl, I just want me with you like ice water. Me, mama, she be about you. Be spending my paper. After tonight, I go live till they see you later. Pass on a vendetta against me, cause of you, I got many haters. Girl, I just every little thing you did up to me.
Pull the JP on the wheels of steel.
She love me feel for them. Get your bullet, make her go crazy. I'ma get see you sure for me. Say make her withdraw money. Oh, no good and good. Make her carry your luggage. I define you for this. I no drugs are fit to contain. Your body na baggage. So you don't see I'm falling for love. Overdose me, love the overdose me. Now you, I want me love you, waiting for lolo. Overloading, I'll be overloading. Your bank account, money plenty, tell me the don't tell me love it tastes like this. Got my money in my pocket like this. Bitcoin in my wallet like this. Please tell me that my knowledge like this. Follow God, I know they follow man. But you, I might have to consider. Trips to LA taking photographs. You sign by me, then it's an autograph.
Live to die another day for you, baby. Quit my Casanova ways for you, baby. The only time that you say that you hate me is when I take the last slice of pastry. Now I'm on the run. Loving you till kingdom come, but you drive me crazy. Send someone, still my billboard, baby.
My number one, see they be. You dey, I mean like by me. I just wanna be there when you need me. Baby, now you matter, I dey sing all day, yeah. Overdosing, body overdose. I'ma say you carry overload, and you know you ball like commando, yeah. Oh, no good and good. You can carry your luggage. I define you for this. For this, I no drugs are fit to contain. Your body na baggage. So you know, see I'm falling for love. Overdose me, love the overdose me. Now you, I want me love you, waiting for lolo. Overloading, I'll be overloading. Your bank account, money plenty, tell me the if you see her no man, tell am she be the one, no. Cause I know in my heart and my soul. I walk all many kilometers. I suffer one time when mo shira no ba. All day. Now you there for my side. Call you back for my life. Give me room in my side. They don't say I try. Only there for my side. Call you back for my life. Give me room in my style. They don't say I try. So make I no talk about all the facility. Because you know say I believe be out of stability. The bally power nipping. We no money not the artillery. I'm the artillery for days. So you barely shame me. I just took a shot of whiskey. Get to sunny nature. You know you're way magic. You know you're way magic. So you barely shame me. I just took a shot of whiskey. Get to sunny nature. You know you're way magic. You know you're way magic. I walk all many kilometers. As of I want to be more shit on the back. Oh, I walk all many kilometers. As of I want to be more shit on the back. Oh, yeah. See it today for my left, call it for my right. If you say you want check, I still get one for my right. See it today for my left, call it for my right. If you say you want check, plenty
Tell me what you want.
go.
one go down. The dead you want place, they want to knock. It's not the same way that I can knock. Tell the teachers to run it back. There to carry problem, come out your back. Baby girl, tell me what you want. It's right here, I got what you need. Leo mama, keep the days to up at the beat.
Check.
Question, but then no get the answer. 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 Answer. Bossa, do. Lagos Oriental when you they move. See green light when I look at you. Last time I take picture with you. Now my cassava where you they look. When I say I know, see you wait till you do. See when we go get it, why I like to listen. Got to one you console. Anything you wish me, that be a passion. Man no be God. Make them they talk. I see they fly like helicopter. Now by the grace of God and inshallah with them move.
Hello.
Question, but then no get the answer.
All right, ladies and gentlemen, we're about to continue the program. So please, if you're outside, kindly find your way in so we can continue. If you're on the queue, I would urge you to hurry it up. We'll give you like 10 minutes max so you can finish up and then join us. But please, if you're not on the queue and you're outside, please find your way into the hall so that we can continue with the program. The earlier we started, the better. Thank you so much.
Like helicopter. Now by the grace of God and inshallah with them move. Question, but then no get the answer. Question, but then no get the
Live to die another day for you, baby. Quit my Casanova ways for you, baby. The only time that you say that you hate me is when I take the last slice of pastry. Now I'm on the run. Loving you till kingdom come, but you drive me crazy. Send someone, still my billboard baby. My number one, see they be. You they, I mean like by me. I just wanna be there when you need me. Baby, now you matter, I dey read. Sing all day, yeah. Overdosing, body overdose. I'ma say you got it overload. And you know you got like commando, yeah. No go down. The body your luggage. I define you for days. No drugs I fit to contain. Your
of Steel.
Then go bounce with your boo. I can vouch for my crew. I'm telling you, and to they do lifestyle of a group. Make you dance, look they look, then go they look, then go they look. And say if it's not enough, if I do 99 good, it go remain one. Don't know how to show you my love without fucking up, but I can buy you a new baby, straight from me, July.
But we go trouble their timeline. Give them a reason to love. Trouble their megawatt. Megawatt, what Lord? Trouble their timeline. Give them a reason to love. Trouble their megawatt. Megawatt. Baby girl, oh, you look at me. Now I so look at you. Keep it tight in a wine. Keep it tight in a wine. Baby girl, oh, you look at me. And now I so look at you. Keep it tight in a wine. Keep it tight in a wine.
You're rocking with the Jeffy on the Wheels of Steel.
Follow me go to Mozambique. Baby girl, are you on your way? She made her bring helicopter. Oh, na. Shake it up like I do overdo. But we don't trouble their time. Give them a reason to love. Trouble their megawatt. Trouble their time. Give them a reason to love. Trouble their megawatt.
to shine unaka. Show why me. Mr. Money no dey waste time. Mr. Money want to ease your mind. Hello, you carry back a lot of filo. I'ma take a phone no go dey ghost you. Let's go play with them kilo.
Distinguished ladies and gentlemen, welcome back from that very short break. Thank you so much for being cooperative. I'd like to quickly say that if you're outside, please find your way into the hall. If you're still getting your tests and scan done, you have about 5 minutes to complete that so that we can continue with the program. Thank you very much for cooperating. Very quickly, would like to continue the program. But once again, I'd like to crave your indulgence. If you're outside at this moment and you're not doing anything per se, please find your way into the hall so that we can continue. All right, ladies and gentlemen, in no time, there will be drinks passed across, so apologies to those who are feeling thirsty at the moment. But very shortly, the drinks will be distributed so that at least you can quench your thirst. We'll be done from here in no time. Thank you so much for being here. Thank you so much for taking out time to attend the PCOS Awareness Conference 2024, in case you're not aware. And the theme for this year is you and your hormones. And we've had very rich conversations before the break. And we're going to continue now very shortly. But I'd like you to look at the screen. There is a code here that you can scan. And for those who don't know, aside the scan that is going on, you can also get a free virtual PCOS consultation. So whatever questions that you have regarding any of the conversations that we've had prior, or anything that you think you want to know about yourself, or you think that you want to ask about your body, please do well to scan this code. It will take you to a place where you can register for a free virtual PCOS consultation. So it leads you straight to a website where you can register for a free PCOS consultation, and there you get all your questions answered. So scan the code. For those who are not here, please do well to find your way into the hall. If you're interested in the free virtual PCOS consultation, do well to scan the code. Thank you very much. Now, very quickly, we'll go to the next item on the agenda. And I'd like to call up our next speaker, who will be giving us a demo. The next speaker is giving us a PCOS fitness routine demo. And it's going to be led by none other than a dynamic fitness coach, a contortionist, and a dance minister with over a decade of experience performing and teaching. As a skilled social media strategist and community leader, this person has successfully grown platforms, creating impactful content that empowers and inspires. With a foundation in mass communication, she seamlessly blends movement, media, and motivation, the 3 M's, to drive positive change. So ladies and gentlemen, please put your hands together as I welcome for the PCOS fitness routine demo, Mayowa Ojo. Please put your hands together as she comes up.
Thank you. Hello everyone. Can we hear me? All right, awesome, perfect. So my name is Mayowa Ojo, like she said, and I'm sure you're wondering how I have 10 years of experience with my quite young face. But anyways, I started contortion in secondary school when I was in SS2, I think. So contortion is an act of extreme flexibility. So I'm extremely flexible and I can do really cool, awesome stuff with my body. So that's how I have 10 way earlier over there. So in Nigeria, I started really, really young, and I'm self-taught because we don't have a lot of places that teach things like this in Nigeria. And one of my passion, one of my goals is actually to work on that in Nigeria. Have a place where people, young children can go to when they want to learn contortion, gymnastics, and let it not just be something that is just done, abroad and not in Nigeria. And over time, I came to fitness, and fitness came about because I was flexible, and then I delved into yoga. And I know in Africa, we're not really comfortable with the word yoga because of the spiritual part that is tied to yoga. But I want to assure you that when I use the word yoga here, I'm not talking about the spiritual aspect. I'm just talking about the art of flexibility, the art of just distressing yourself, and not necessarily the spiritual aspect of yoga. But alternatively, I'm going to use stretch instead of yoga. So just know that it's the same terminology and the same things that I'm basically referring to. Are we good? Awesome, beautiful. So with PCOS, how many of us love exercising? You love it genuinely. You love it genuinely, not because I'm asking. Okay, awesome. About 10-20% of us, and that is perfectly okay. Just today I was having a conversation with someone and she said she doesn't like working out, that it stresses her out. And that's one of us out. Because with PCOS, we know an enemy is what? Stress. You do not want to stress yourself out for anything whatsoever. And I'm here to tell you that you can work out without stressing yourself. You don't have to do jumping jacks. Oof, No, we don't do that here, okay? Anything that is stressing you out, say bye-bye to it, please. With PCOS, you don't need it. But you're going to, if it's something that goes, okay, stretch it out, okay, easy peasy, like, if that's all you can do, it's perfect. Instead of just not doing anything at all. If all what you can do is this, every morning before you go to work, stretch it out. Perfect, no pressure. And something she said during that conversation about why she did not like working out with PCOS is the fact that she said it stresses her out, number one, and number two, it gives her body pains. So when you want to start stretches or anything PCOS related, you need to start slowly. The first day you start is not the first day you should start doing push-ups, for example, 100 reps. No, that's not how to start working out with PCOS. When you start, okay, give yourself 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and you are done with that particular one. When you do another exercise totally, give yourself slow counts, not something that is going to be 100 counts, 50 counts, and at the end of the day, all your thighs are hurting, all your muscles are hurting, everything just feels wrong. Do we understand? Yeah. Beautiful. So one thing I'm also going to talk about today is the fact that PCOS causes insulin resistance, which most of us know about. And one way to balance that out is with working out. It helps you to balance out the androgens and then also to help your insulin work better. I'm going to be giving a demo about, I won't be able to touch on much because of the way this is set up, but I believe that I'll be able to touch on how you can start effectively at your own pace, in your own homes. You don't have to go and sign up at a gym. You don't have to go and sign up at somewhere that might now discourage you at the end of the day. But anyways, I'm going to do the demo now, and I'll hope that we just watch and see how I'm doing it. I'll explain at different intervals, and then just keep it at the back of your mind. And also, I believe we have the video, so you can also play back maybe later. The link is on our platform on Instagram. So when you want to start working out with PCOS, for those of us that do not know, I know a few of us are actually fitness experts here already. That's beautiful. But for those of us who do not know and want to start working out with PCOS, you want to start with stretches. Like I said, yoga, but I'm not using yoga because of the spiritual aspect related to it. Stretches. Beautiful. From your head, work on going from head down. So from your head, you're working on your neck. From your neck, you work to your shoulders. Stretch out your shoulders. Okay? Easy peasy. There are different directions your shoulder can go. Different directions your shoulder can go, as far as your shoulder can reach. Beautiful, and that's on shoulders. Okay? Next out, move to your wrists. Gentle circle, nothing exhausting. Next, your waist. Either you do this or take it out with your legs spread out. Easy peasy. Bring it down here to your waist. This particular pose is not only working on your waist, it's working on your thigh, working on your back. And then just take it down to the floor. And take it down. Move into a downward dog and just relax into the positions. Take your time there, no pressure. If you want to add more spice, take your legs up, feel the stretch in your thighs. No pressure, go as far as you can. If your leg is here, beautiful. If your leg is here, beautiful. If your leg is here, also beautiful. No. Are we still here? Awesome. My positioning might affect that, but sorry. This position, you do a dog pose and cat pose consecutively. This is working your spinal cord. And just rest in your baby pose at the end. If you do 10 counts in each of these positions, from your head down to your legs, you would have done at least 20 minutes of workouts if you're keeping it at a count of 10, 10, 10 each. One also great form of exercise for PCOS is strength training, and I'll demonstrate a few strength training exercises you can do. If you have dumbbells or resistance bands, also perfect, but today I'm just using things that you can do with your body alone at your house. No pressure of going to the gym, no pressure of using any dumbbells or resistance band. So for strength training, we have squats, and you're using your body weight for this. So there are different types of squats. This particular one, so one problem with squats that I notice a lot of people do, your legs should be straight. Your legs should be straight. Don't do this and don't do this. I see a lot of people do this. You're just stressing yourself out. Except maybe you want to be flexible and work on your inner thighs. I actually do this to work on my middle splits. But if you're not working on your middle splits, there's no need for you to do this in a squat. Keep your legs forward, okay? You should feel good in it. Keep your chest up. You should actually feel good. If you're feeling awkward, you're most likely not doing it right. But you should feel good in it. This, you've turned the workout to working for your middle splits if you're doing this with your legs up. That's something else totally. Also strength training, fantastic one. Shoulders. You want to work on your shoulders. If you can't do a press up, perfect. No pressure. Do shoulder taps. The more shoulder taps you do over time, the more strength you're going to build to be able to do this over time. Are we good? When you're starting, please don't start with this. You're going to end up with body pains. Truth. I'm sure I'm going to feel body pains after this. So, with all of that, strength training is the one I just did now, and I showed us just two. 3 push-ups, shoulder taps, and squats. Stretches I did from your head. Focus on starting from your head down to your hands, waist, legs, and all of that for stretches. And we also have Pilates. Pilates is more of really, really controlled movement. I know there are some places in Nigeria where we have reformer Pilates, where you can use the Cadillac to do your Pilates. I think, I'm not sure I'll mention the names here, but if you check online, there are I think there are just 2 places in Lagos that have reformer Pilates if you want to do that. But at the comfort of your home, Pilates can be as easy as this. Okay? At the comfort of your homes, Pilates is as easy as this. It is harder than it looks. I make it look smooth because I've done it quite a lot of times. Okay? Pilates can be this. And this is perfect for your core. If you are having issues with your stomach and you want to build some good muscles there in your stomach or reduce it over time, this is something good for you to try. Okay? Beautiful. So I'm going to keep it at that for today. I mentioned strength training, Pilates, and stretches. So now we're going to take a quick exercise, a quick breathing exercise, which is something I usually do at the end of my workouts. Trust me, there are a lot of times that you think you're breathing and you're not breathing. And I'm going to prove it to you right now. Breathe in and out from your mouth. In from your nose and out from your mouth. I know the air is a bit cold, but bear with me. In from your nose and out from your mouth. Deep breath in and out slowly from your mouth. Fill up your lungs with air in. Hold. Slowly from your mouth. Fill up your lungs with air, breathe in. Hold. Slowly from your mouth. I'm sure you feel that calm already. Let's go in. Hold. Slowly from your mouth. Now we're going to take shorter, faster breaths. And hold. And normal breath in and out. Do you feel that calm? A lot of times you think you're breathing, you're actually not breathing. Especially times when you're anxious, when you're stressed, you just realize that you're holding your breath without you knowing that you're holding your breath. So you always want to ensure, even if you're not working out in a particular day, you get home, you feel stressed from that day. Good thing for you to do is your breathing technique. Just breathe in. I did a very basic breathing technique here. There are other types that you can do that are different from this one, but you're still going to get that same effect. You can check YouTube, a lot of resources that are free on YouTube. Check it out, use it for your advantage, and with time, you're going to know that working out with PCOS is not something that should be feared. It's something that you should love doing. And I'm not even looking as fit as I should be looking because I just gave birth in April, but it's something that I've also started working back on, so we are all working on ourselves, trust me. I've not stopped working, I always have to keep on working, but slowly and surely. And even as I gave birth, I knew stress was something I had to run away from, although I fell into the mistake of jogging. I went jogging about 2 months postpartum and my breast milk, disappeared, thanks to the stress and the malfunction in my hormones and everything. But stress is something that you do not want to joke with. You might think, oh, let me just go jogging, I feel good today. Tell that spirit, shh, I silence you. So always just go for something that makes you feel good, okay? So I'm going to take 3 questions, just 3 questions if there's any. In case I've missed anything in particular that you want me to respond to, just 3 questions. Any question? Any question? So no questions. Okay, someone is there. Can we give her a microphone, please? Any other person? 2 more people. Any other question? Any other questions? Okay, 1 more person there. And we'll take a last person if there's any other after that. Please keep your hand up. The lady that wants to ask a question. Yes, so 2 of them.
Good afternoon, everyone. So you said jogging, okay, so you didn't say it's not good per se, but why is it not good? And then compared to walking, right, we know walking is good, so is there an alternative that, okay, we should walk more, maybe you should throw more light on that?
Okay, also beautiful question actually. So walking, I even actually forgot to mention walking. Walking is also a good form of exercise if you don't want to probably do any other form of exercise and you just want to clear your mind. Brisk walking, there are different types of walking. There's slow walking, there's fast walking, there's different types basically. But with jogging, I just realized personally that jogging, it increases your heart rate, makes you breathe more. This might not really attune or be linked to this, but for example, if you're anemic and you have shortage of blood with PCOS, that might be problematic on its own. So basically, jogging is just something that is classified under, let's say, high intensity exercise, for example. And with PCOS, want to go for lower intensity most times. There are some school of thought with PCOS that say it's okay to do high intensity. But personally, I don't support that school of thought. There are different people that support different things. So personally, some people support it and it probably works for them. But personally, I would say jogging is something that is high intensity and you most likely don't want to indulge in that because it might spark up your symptoms, imbalance in hormones, and everything just keeps on the circle. You're wondering why you're not losing weight. You're wondering why you're still feeling stressed even after you're devoting your time to working out. Does that answer your question? Awesome, beautiful. There's someone else.
Okay, so my question is about exercise in pregnancy. how early do you think what is the best time you think a woman that is pregnant can begin exercising, and how do you maintain or how do you control weight gain after pregnancy? What exercises do you recommend? Thank you.
All right, beautiful question. During pregnancy, okay, personally in my first 3 months of pregnancy, I did not do jack. The first month, I was still feeling like I could do this and I'm going to crush this, but it crushed me and I didn't crush it. I was vomiting and very, very sick, so I didn't have energy for all of that at all. But if you have energy for it, I would say first trimester is not the time to start exercises that you were not doing before. I was flexible and I was still doing a lot of that. Even my first trimester, I still did a lot of performances and everything that I could manage at first before it really hit me. But if you were not doing anything before, that's not the time for you to really start on it. The best thing for you to do is start slowly, like I said before. Start slowly, even if it's just a stretch from your head down. There's some people that say you should not bend down, you know, so the blood does not break and everything, but I think they're a bit too extreme. But if your heart does not carry it, I would advise you to just stay away from it and just stick to things that you know can work for you and don't really affect your stomach at that early stage. Now, when you talk about second trimester and third trimester personally, I did a lot of splits. Anything to just get my legs open. I did a lot of it because I didn't want to hear stories that touch. I wanted my hips to be as open as possible. And not just even that, I noticed my back. There's this heaviness that comes in your stomach in third trimester. When I do exercises consistently in third trimester, I noticed that I had more strength in my back. That back pain just disappeared. So doing exercises, for example, this particular one, even if it's tough like this, and leg raises, very easy, no pressure on your stomach, just your leg is doing the work, but other parts of your body are also engaged. Even if it's just this, and you stay there, count to 10, your body is still working through it while keeping your baby and you safe. And you're going to get the benefits and results at the same time. So that's what I would say for third trimester and second trimester. Someone, last question, or that's all? Okay,
I'm
thank
here. Okay, my question is it very realistic to work out every single day, say 6 to 7 days a week? And if yes, how or what is the best way to stay mentally and physically ready and available to work out every day?
Okay, beautiful question. It is realistic in a sense that you do not have to go hard every single day. Today you can take a walk, tomorrow you can do strength training, next tomorrow you can do Pilates, next tomorrow you can do breathing exercises or something else. But if you're always going hard at it, you're going to tire yourself out and you're going to lose interest totally in it because you've taken it as a job, and we all know how frustrating our jobs can be sometimes. So the best thing to do is always keep yourself on alert and you yourself look expectant towards that particular thing that you want to do. Okay? All right, because of our time, we'll be rounding up now. But thank you so much for your listening ears, and I hope that you've been able to learn a thing or two. I love you all, and thank you.
If you're clapping, clap harder for Mayowa Ojo. Thank you so much for the beautiful demonstration. And I was surprised that nobody clapped when she said she just gave birth, and she's looking this fit. So please, a round of applause for Mayowa Ojo. That was a beautiful one, and congratulations on the new baby. All right, very quickly, without wasting time, we'll go to the next session. And the next session is an art therapy session. And the presentation will be done, the art mural will be done by Ini Leye. Please, a round of applause as I welcome Ini Leye to join me on stage very quickly.
Hello everyone. Hello everyone. So here's how this is gonna go. I say hello everyone, you say hi, but you have to say it as enthusiastically as possible. I know that you've been here all day, but I need your energy, yes? So I'm gonna divide the room into 3 sections, and we're all going to sing your group to be in. So this is group 1, group 2, group 3, and I'm just going to rile you up a bit, so you just indulge me, okay? So you're either apple, watermelon, or pineapple. Just decide which fruit you want, and I'll call you by that. So let's do that quickly, like 2 seconds. Watermelon, second group, great. All right, group 1, what group? Apple, okay, great. Group 3, pineapple, okay, so those are, okay. In the different places I've gone to, group 2 always picks watermelon. I don't know why. All right, so we're all going to get up. Just indulge me for just like a few seconds. How many of you can sing like in harmony? You know, like alto, soprano, tenor. I love it. Alto, we're actually the best singers. I don't care what soprano people say. Yes. Sopranos, they think that they're it, but not really. Okay, so the song we're singing is my head, my shoulders, my knees, my toes. We're going to sing it in harmony. Okay, so the best group wins. All right, I won't tell you what you win, but hey. Okay? All right, so we'll go and we'll sing it on time. 1, 2, 3. So here's how it goes. Group 1 sings, group 2, group 3, then we all sing it together. But we're going to give it as much energy and as much harmony as we can. Yeah? Also, I really want to hear you guys bring it. Make me proud. Okay? Thank you. Thank you so much. I believe in you. Okay. Group 1. Are you ready? So, oh, sorry, you're not group 1. You're at group apple. Group apple, watermelon, and pineapple. Okay. So 1, 2, 3, go. I'm not hearing any harmony. All right, watermelon. Slow start. Let's go. So beautiful. Going off key. Pineapple. Come on. I'm coming down for this. What? Let's go. Let me hear it. Hey. All together now. Let's go. You sound so beautiful. Please give yourselves a round of applause. I think the group, you can sit down, you can sit. Thank you so much for indulging me. Group Pineapple, you guys had an advantage because you had like a bass singer here. Oh, you were? Oh my goodness. You're amazing, amazing. Thank you so much, thank you so much. All right, it's amazing how music can just change things, yeah? It's amazing how music can just change your mood in a split second. So my name is Ini Abasi, but everyone calls me Ini. I'm an art therapist. I'm also a sex therapist, but I focus mostly on being an art therapist today, yeah? So what does art therapy mean? I heard you. What does art therapy mean? Basically, I sit in sessions with clients, take them through therapy, and I use art. I use different forms of art. I use aroma, I use sound, I use crayons, pencils. Hi, Amy. And usually when you bring out the songs or you bring out the crayons, people are looking like, am I a child? Why are we doing this? But it turns out that at the end of the day, you feel so much better, yeah? So what art therapy does is that it helps. It helps to distract you, but in a good way. It's a good distraction from the intensity of what you're going through in the moment. It also helps to release hormones like dopamine, oxytocin that actually help with easing your brain. So you see the way your brain reacts to different instances in life, especially instances that it regards as traumatic. The part of your brain that's in front is responsible for holding all your good memories, your good feelings, your fuzzy fantasies, your dreams, your happiness. And the back of your brain actually is responsible for holding all your negatives, all your bad experiences, the sadness, the anger, and all that. So what happens is, a lot of times as you're going through life, as you're going through your everyday, when you push things to the back of your mind, have you ever heard the term that says, I just push it to the back of my mind? It's literal. The bigger it gets, the more clogged it gets, the more in control it becomes, because that's where your focus is. So, what art therapy does is to help kickstart your prefrontal cortex. So, can I just see your 2 fingers? 2 fingers like this. I'm sorry today I don't have crayons and I don't have paint. We don't have the wall mural. But I do have, you do have me. So yeah, so your 2 fingers, your left hand to be precise, because your left hand is directly connected to your heart. And so if you're gonna trigger your prefrontal cortex, you can also trigger the good feelings in your heart. So you're gonna tap your forehead for me, but you're gonna do it twice, or you're gonna do it on time, in beats. So we're gonna go 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. So a lot slower than I said. 1, 2, 3, 1, 2, 3, 1, 2, 3. But I'm gonna count for you. So I'm gonna count 1 to 5. While we're doing this, I want you to think of anything nice, okay? Anything nice. It could be ice cream. What flavor of ice cream do you like? Chocolates. Chocolate, chocolate. Chocolate. Who likes pecan here? Pecan. You can think of music. Who's your favorite artist? What kind of music do you like? You said? Who? Wizkid. Someone said Asha. So just think of that. Think of something nice and fuzzy. Who likes duvets here? Warm duvets. Duvets, a Johnny Drill. You said? Classical music. Amazing, amazing. You're my kind of person. Who likes jazz? So I just want you to think of different things that you like. You're gonna close your eyes. You're gonna tap your prefrontal cortex, okay? So we're gonna go on count. 1, 2, 3, go. 1, 2, 3, 1, 2, 3, 1, 2, 3. 1, 2, 3. Don't look at me. 4. As you're leaving here, you're going to think of the things you thought about now. Okay? You can send me a message or you can call my phone when that happens. All right, so how does art therapy help you? I'm just here to talk about that. A lot of people don't believe in therapy. A lot of people do. Therapy is fast rising to become a really good source of help. Therapy helps because you can talk to someone who's unbiased, someone who doesn't know a thing about you but then gets to know so much about you. Therapy helps in a way that you can talk to a professional who helps you to navigate your emotions. When we're going through things, oftentimes we're focused on the thing that has happened, but then we don't really know that everything that has happened now and how we are reacting to it is actually a makeup of everything that you've ever been. Does that make sense? So who you are now, as you are right now sitting here, you are a makeup of all the experiences, all the influences that you've ever had since the day you were born. And when things happen to you, what happens is you react in the way that you know how because you've been influenced or taught in some way. What therapy does is helps to shift not just your perspective, but also teach you how to react, how to control, how to maintain focus, and how to cope with life. I like to believe that what art therapy does is that it teaches you how to be a child again. And as you're growing up in life, as you're shedding so many things, as you're dealing with so many experiences, what it is that you're really learning how to be 5 years old again. It's just that this time you now wear glasses, you're wearing heels, you go to work, And so art therapy does a number on you. It actually does help in a plethora of ways. I want to teach you a lot of things, but I don't have time. But I will say this. If you do get the opportunity to go to therapy, please do. If you do get the opportunity to sit with a therapist, please do. If you do get the opportunity to pay for someone to go to therapy, please do. You never understand the gravity of what therapy does for you until you're done. Since 2020, when I began my practice, I've sat with roughly over 300 people. Not to toot my own horn, but I see that both paid and unpaid clients, I see that the need for therapy, especially art therapy, is fast rising. Sometimes I sit with clients and we don't talk at all. I just ask them, what kind of music do you like? Sometimes I introduce my kind of music, classical music, jazz, and it does help. Sometimes all you need to do is just sit in a good ambience with a cinnamon candle and jazz playing. Preferably Norman Brown. I'm trying not to be biased, but that would help. Writing is another form of art therapy that helps. Keep a journal. If you don't have one already, keep a journal. And I'm not talking about your notepads on your phone. Okay? There's a huge difference. A huge difference. You can write with your notepad on the go, but you see, the thing about screens is that it's designed to keep you occupied and keep your eyes focused, and it's also designed to distract you. And what you want to do, what therapy does is that it helps you center, helps you focus, zone in on what exactly you're going through, and it helps you to get to the root of it and get out of it. Your phone is only going to distract you. If you're writing on your notepad, before you know it, an alert comes, hopefully it's a credit alert, you know, or a notification comes and you're in Instagram and you're just scrolling mindlessly, and then you've forgotten about what you're going through until another day when you remember, or the feelings come back and they come back more intensely. So write, get a journal, create time to do it. I know life is busy, Nigeria is crazy, but create time to do it. Sit alone with yourself. You could even do a date with somebody, a journaling date, where you guys go off somewhere to a cafe, a restaurant, an Airbnb, or in your home. Sit down and journal your thoughts. The focus here is to get you to zone in on what you are going through, not for you to sit and have a pity party, but to actually focus to terms with the fact that this is happening, but I can get out of it. Yeah? So, does anyone have any questions for me before I run away? Yes, please. Do you want the mic? Okay, I'll try to hear it. How do I get myself to just start scribbling? Like, where do I start? Just start. Don't overthink it. Write the first thing that comes to you. So if you're gonna write now, what would you start with? Start with how you're feeling. Sometimes just write words. And if you can't write words, draw. Draw something, draw a circle, draw a series of circles, and then put under the exact emotion that you're feeling in the moment. And then go draw another circle. And then if you're trying to describe the emotion and you're trying to bring it out, write out a sentence. Yeah? And then leave it. Go away and come back. Sometimes all you need to write is just one paragraph or just 2 words. Need air. That's okay. You come back, you write some more. I need air because you go away and come back. I need air because lately I felt like I can't breathe. Or you write, where are my friends? You go away and come back. I know so many people, I feel like I don't have friends. Go away, come back. And if you want, you can make it as creative as possible. Get some stick-it notes. Get some highlighters. Get some crayons. I really recommend crayons. There's something about it. It's really freeing, yeah? You become a child again, and that's what we need to do, really. We really need to get in touch with the child inside of you. So I hope that helps. One more question. One more question. Yes, please. It has a lot, actually, because sexual activity, you guys, I thought you guys brought me here as an art therapist, not as a sex therapist, but it's okay, it's fine. So, sex in itself has a lot to do with hormones, especially for the woman. And it's just the way that we're intricately built. We're just, we're designed with a lot of complexities. And so with PCOS, which has its up and down movements of your hormones and the imbalance and all of that, instead of going into too deep, what I would say is, here's what you do. Get as much exercise as possible. Balance out your diet. Speak with a nutritionist to make sure that your diet is balanced. And it's a balanced diet for you, which is the reason why you need to speak to a nutritionist, because it has to be a diet that is unique to you, your hormones, your body system. Exercise, your diet, sleep. We underestimate how much rest and sleep affects sex. It really does. If you're stressed out emotionally, physically, mentally, you cannot enjoy sex. It's a no-brainer. So rest, your balanced diet, and exercise. Really important. I hope that helps. Yes, last question. By all means, yes, please go back to read what you've written. So it all depends on you. You see, journaling is emptying your thoughts on paper. The good thing is that you have it. You can go back and see how far you've come. You must remember to go back and read it to see how far you've come. Because what journaling does is that it helps you measure how well you're doing mentally. You go back and see, oh, wow, I was this dark. I was this down, and then it encourages even you to see that you are actually killing it. You're actually making progress. You're actually doing better. And you see that as you journal, and depending on the kind of environment that you're also existing in, you see how well your thoughts are doing. So as you're journaling, don't forget to add being in an environment that promotes happiness, being in an environment that actually promotes you being in a good mood. Not just a good mood, but you just being good overall, yeah? So having the good people around you, eating good food, getting good rest. And you know, rest is not just about sleep. It's also about the enforced rhythms of grace, not rushing to do everything. We live in a time where we're always in a hurry. We're always rushing. Slow down, okay? So I hope that helps. Does that help? Awesome. Thank you so much, everyone. Thank you so much for having me. Have an amazing afternoon.
Thank you so much. Ladies and gentlemen, please once again put your hands together for Inia Basileye. For those who don't know, she is a dietitian, and she founded Rome's Art Therapy and the Orange House Art Residency Program to nurture mental health and creativity, and also inspires others through her work as a mindset transformer, artist, therapist, broadcaster, and writer. And of course, she is a sex therapist. And how many people learned something? You learned something new. All right, so put your hands together for her once again. All right, ladies and gentlemen, very quickly we'll be going to the next panel discussion now. And without wasting time, somebody seems very excited about the next panel session. Can I ask why? Can everybody hear me? Okay, so the next panel session is a discussion centered around hormones and health nutrition, as well as the naturopathic way. So this discussion is also going to be a very rich one, and I think that a lot of people already know some of the panelists, so I'm just going to go ahead to introduce the moderator. So ladies and gentlemen, our moderator for this particular panel session is an accomplished actor, one of my personal favorites, and a producer with a bachelor's degree in film and television production. She has a diverse portfolio spanning multiple platforms, which includes, and not limited to, Africa Magic, Prime Video, and Netflix. This person is best known for her breakout roles in popular series and films like The Men's Club, Castle and Castle, Riona, and The Perfect Arrangement. And outside her professional work, she enjoys gardening, reading, painting, traveling. I'm sure a lot of people are like, just cut the crap and call this person already. Ladies and gentlemen, please join me as I welcome Mimi Chaka.
Thank you so much. Guys, I know it's kind of cold, but please help me. So, welcome to our panel. Today we'll be talking about hormone health, nutrition. Everything we'll be going through would be from the angle of food as medicine. Naturopathic remedies at which we can manage our PCOS and hormonal balance. So I hope you're excited. Okay, so without further ado, let's meet our panelists. First off, we have Nene Adedokun from Naxa Wellness. Nene, please join us. Nene is a nutritionist specializing in hormones. Welcome, Nene.
Thank you. I'm excited to be here.
Secondly, we have Halal El Hashim, a functional nutritionist from ProSkin. Welcome, Halal. Her work focuses on the intricate connections between gut health, metabolism, and hormonal balance. Last but not least, we have Chef Amaka Wakalo Ejemba from BAM Wellness. Welcome, Amaka. Chef Amaka brings a unique perspective combining culinary expertise with nutritional science to make PCOS-friendly eating delicious and healthy meals. Welcome, everyone.
Thank you.
So as all the speakers have said before us, we know PCOS affects millions of women worldwide. And we know that there are readily treatments available to manage them. But the naturopathic ways have shown an improvement in PCOS management and hormonal balance. So I want to start off with you, Nene. Could you explain how specific foods and maybe eating patterns can affect?
Question, just to correct you on there, I am a naturopath, yes, and also naturopathic medicine deals with traditional medicine, you know, combining it with modern medicine. So thank you so much again for that question. So looking into different eating patterns and different foods and how it, you know, affects the blood sugar, it goes deeper into, number one, a personalized nutrition. So you want to focus on something more personalized to you. You know, in naturopathic medicine, the first thing that we look at is your root cause. You want to know what is the root cause at that moment, right? So when you're looking at your blood sugar, so let's say you have insulin diet, focusing on complex carbs, focusing on food.
Can you hear me, guys?
Yeah.
Okay. Well, in this climate, I'll say specifically for me, I love sweet foods, but I also know that they affect my blood sugar. So I grew up around people who had diabetes. So I do this mango leaf rinse. It's almost like boiled mango leaves, and then you drink them the next day. Would you advise this climate? Because I know it's so easy to abuse certain naturopathic ways.
Okay,
Yeah.
thank you. Yeah, thank you for that. So when you talk about herbal remedies, it's very good to always work with an expert, you know, because that's the problem with African herbs. It's not standardized. You don't know the correct dosage, you don't know the correct frequency, when to use it, when not to use it. So most times it could be abused, right? In Naxa Wellness, what we've done is we have pharmacognosis we work with, pharmacologists, and you have to know that these particular herbs, this is the exact way I should take it, or this is the exact way I should not take it. Now, when it comes to African herbs, right, you see that most of the times we don't even have a lot of ideas about it because the information is not really passed accurately. And there's no clinical research, clinical findings that is put into it. You know, but when you, because for someone like me, the experience that I have is more on Western herbs and Chinese medicine. That is because this is what has knowledge, this is what is being researched on. So it's a key thing for us to know that when you're working with herbs, it is good to have people that know how to use these herbs, in what quantity and in what dosage. So that's just make sure it. Yeah.
Hello, this is for you. The gut hormone connection is a hot topic. How does the gut hormone affect PCOS? Okay, thank you. Hello, the gut hormone connection is a hot topic. How does gut health impact PCOS? and what strategies can you advise to help? Now, I didn't even know anything about gut health till like a year ago, but it wasn't until it started affecting my physical appearance. So what would you say is the best way to tackle it, and what impact does gut health have on PCOS?
So first, I'm very happy to be a part of this conference. And I want to start by saying, everyone knows this famous thing that you are what you eat. So everything we eat affects us. So what is gut health? Gut health is everything related to our digestive system. So I'm sure many of us have problems like constipation, diarrhea, feeling bloated after eating, having headache. So this affects our mood. Now we have something called intolerance test. This is a small test that you do. They use your blood, and it works on antigen. So you can trigger the food that is behind all these symptoms. It can be maybe beans, some other will be lactose intolerance. Also it can be something we don't think about, maybe egg, maybe bread. So we need to understand what is behind these symptoms. If our sugar level is high, so it's related to insulin resistance. It's also related to cortisol level. If our cortisol is high, if we are stressed, our cortisol is high. If our cortisol is high, we are feeling all the time hungry. We can't sleep well. So it's a cycle, and everything is related to each other.
Okay, I'm going to ask another question again because I'm very excited about this. So I like turmeric, ginger, coconut water, and cumin blended in the morning. I read somewhere that it's really good for your gut health. But I feel like sometimes when I'm in that mood to be very fit and I'm like, no, I'm going to stick to it. If I eat badly, do naturopathic remedies work as effectively as they should? And I mean...
So I'll just say something. You cannot drink this healthy drink, then go have your heavy meal, and then say, oh, it didn't work, the healthy drink. The problem is your heavy meal that you eat. So it's like you have to do all together to have the best result. You have to eat healthy. You have to take those healthy supplements that now all the studies are showing the positive effect on PCOS. But it works all as a package. Sleeping well, having sport activity, eating well, taking all these supplements, it will work for the best result.
Okay. Chef Amaka, many women find it challenging to stick to a PCOS-friendly diet. By many women, me. What would your advice be in creating fun meals, delicious meals that still keep our bodies in check?
Thank you so much. So the issue is people feel like when you are diagnosed with PCOS, there are certain things that you have to stay away from. And that is actually the problem. The problem is we need to look at it in the way that, okay, how do I go through this journey and enjoy it? So when I was diagnosed with PCOS, I wasn't educated properly until I met my doctor, Dr. Lewu. She's my gynecologist. And then she took me through that pathway. And while she was teaching me, I had to tell myself, okay, so how do I enjoy this journey? Because I like food. I mean, if you go through my page before I started advocating for PCOS, if you go down, you will see foods. I like food. And I love good food. And so one of the things I asked myself is, how do I go through this journey and make sure I enjoy it? I came up with 3 energy. That's vitality. Number 2, it must nourish your body. And number 3, you must enjoy it. If you are nourishing your body and you are having energy and you are not enjoying your food, my sister, that's trial and tribulation. I don't believe in that. I believe that my food should be enjoyed. I believe it should give me vitality. And I believe that it should give me strength. So what did I do? I had to look at my Nigerian foods. I didn't go far. I had to look at the Nigerian foods that I can enjoy. What is the best way I can go about it? I learned about portion control. I said, okay, since right now I need to prioritize my vegetables because my kind of PCOS is insulin related. You need to know the kind of PCOS that you have, right? So mine is insulin related. And I had to watch my carb intake. Do you understand? And then when I analyzed it, I found that I need to prioritize my vegetables more. So when I prioritized my vegetables more, I started thinking of creative ways to incorporate my vegetables. So I ended up finding out that I can make pepper soup, and then I can get attaché, remove the seeds, get green peppers, get carrots, stir fry it a bit, and add it to my pepper soup and eat it alone. I'm enjoying myself. I'm eating meat. I like meat, right? I eat fish. I like fish. Then I had to now find, okay, I mean, we grew up while we are little, eating more of carbs than the vegetables and the protein. That is how everybody, was grown up, grew up to eat. So how did I go about it? I had to look for other alternatives, other healthy carbohydrate alternatives, or rather eating the present one I had available, but in small portions. So when I want to eat my jollof rice, I just go ahead and eat maybe like half of my plate. I can have my vegetable stir fry, and then I have my jollof rice, and then I have my meat. So one way for you to maintain your healthy eating diet and make sure that it becomes part and parcel of you is for you to make sure that whatever thing you are trying to bring together is something that you enjoy. And number two, you make sure that it is a balanced diet. You have to enjoy your food and make sure that it gives you all the nutrients that your body needs.
Thank you so much for that. Nene, let's talk naturopathic approaches. What herbs or natural supplements have shown promising in managing PCOS symptoms? Now, I know you said the herbal thing isn't it's not your strong suits because you feel like it could be easily abused, which is true. I was introduced to black seed oil by a friend of mine, and it's not exactly herbal from here, but I had a weird reaction to it. I felt like it was really, it was not very pleasant, but it has wonderful benefits. What would your advice be on naturopathic remedies that you would stand behind?
Okay, thank you so much for that question. So when you want to start with herbs or naturopathic remedies, the first thing you need to know is your root cause, right? Because people have different root causes for their PCOS and drivers. So if, like for instance, if I'm working with a patient, let's say a root or a client, and she has inflammations as a driver, insulin resistance, you have another person that has something different entirely. What the herbal remedies are going to be different that you will apply. So, but generally, if I would advise everyone as a group in something that you should start with, I would say start with your gut health and inflammation, right? Inflammation is one of the major drivers that we work with as a root cause in naturopathic medicine for managing PCOS. So when you want to work on your inflammation, you can look into something like cinnamon ceylon. This has been studied very much into. But don't forget, guys, always work with your, herbal or someone that is good with that, an expert in it. But this is something that you can work with. Cinnamon Ceylon, not the other cinnamon, Ceylon. You can also work with Boswellia. That's something that is found in India. You can also work with ashwagandha. It's also a good herb. Both is adaptogenic and it also helps with your inflammation. So other natural supplements that you can also apply if you want to start out with something like right now is omega-3s. So these are things that you can apply when looking at herbal remedy and natural supplements for yourself. Thank you.
Thank you so much. I won't say that I am very big on the herbal side, but a lot of trial and error with the doctor. So, you have to, listen to your health providers. And ashwagandha shouldn't be taken more than 2 months at a time. So, in talking about anti-inflammation, it's often discussed in PCOS. Chef Amaka, please, what foods would you say makes a significant difference if you're trying to reduce inflammation in PCOS?
Yeah, this is fine. Okay, thank you. So I feel, or I believe that one of the foods that helps to, reduce the rate of inflammation, for me, if you keep me every day, every time, you cannot go wrong with vegetables, right? And there are several ways you can incorporate it to your meal. And prioritizing it as much as possible is going to make go a long way. I mean, some of us, all thanks to my mom brought me up eating vegetables. I could eat tomato raw, I can eat lettuce raw, I can eat cabbage raw. And I noticed that it actually helps me. Whenever I feel that kind of, I just go on a pure vegetable diet. I'll just eat vegetables, maybe for like a whole day. I'm just on salads or vegetables and maybe a little bit of protein. So I feel you cannot escape it if you go on your vegetable diet. If you add vegetable to your diet, it actually helps a long way. Another thing again that I feel helps is, I don't say this all the time, right, is teas. Some teas has actually helped.
I love teas.
Yeah, teas helped me a lot. One of the teas that has helped me, will I say tea or drink? Zobo. I don't joke with Zobo. Yeah, Zobo actually helps me. I may not necessarily add the pineapple back while I'm boiling it. I will just
add the ginger?
Yeah, that is a must. Oh my God, you must add the ginger. So I put that and I put the ginger and I add a little bit of lemon to give me that tang. And then it's warm and I drink it and I'm good. Teas like that, ginger tea, like Nene said, cinnamon tea, it actually helps a long way. So vegetables and teas actually work.
And if you have heritism, spearmint tea is also really good. And spearmint tea.
It's not so common.
Yes,
it's not so common. So like someone like me, I looked for spearmint tea, I didn't see it. So I gave up and just went straight to cinnamon, ginger, zobo. I don't go beyond these ones, but if you see spearmint tea, it's fine.
Hala, stress management is crucial in PCOS. How can your nutrition affect your stress management? I'll put it that way.
Yeah, I'm sure when we hear the word diet, we hear, I'll be hungry, I'm starving, I can't sleep, I will not eat my best rice ever. Yeah. And that's wrong. That's the wrong diet. So when we want to start this journey, we have to start it correctly. The diet have to be like done for once correct, and it will be done forever. But these yo-yo diets, so starting from Monday, I will start eating rice, pasta, bread. I will only eat my grilled chicken, and then I will only eat apple for 2 days. Then the next 2 days, I'll drink spinach. And, okay, fine, for 1 week, let's say 2 weeks. Then no one can stay without rice, pasta, without carbohydrate, without sweet. So diet is having everything in moderation. As she said, portion control, enjoying our food, and giving our body the time. So we didn't add all this weight in 1 week or 2 weeks. Yeah. Sometimes 4 years, 5 years. Yeah. So at least let's give our body half this time to lose weight. Because when we want to start dieting, we are already stressed before starting the diet. So it starts from here.
Oh, thank you so much for that. So this is a question to you three. Looking into the future, what would you say the future of naturopathic remedies and nutrition is in PCOS in women? What is the future of the naturopathic remedies? Do you think that we'll be able to find a way to measure it and reduce abuse? And what role will it play in women living with PCOS in the next 50 years? Nene?
So thank you very much. So That is a good question, actually. So I feel like in the next 50 years, I see a situation where people, because everyone wants more holistic approach, much more personalized approach. So I see a situation where people are going to be going to a much more natural approach, right? And we together we need to make this happen so that people do not get to misuse it. But I know that if we start putting in effort in how we standardize it, more research on it, because people out there that are also doing the same for their herbs, you know, we can't let, you know, it's so funny that this is some things that we were brought up with. Yeah, so we can't just let it go. Like, because these people are going to come into our country one day, one time, and they will help us find it. So it's something that we need to do for ourselves. And I know that if we start today, and your inputs can, you know, share the herbs that your grandmom told you about, the things that you had in your fridge, all those other things. And it will really help us in seeing how much we can do more research on it, how much we can more standardize it. Because whether you like it or not, people are still going to go into the natural method. So it's better we do it right. So that's it. Thank you.
To add to what she said, the future of PCOS, to me, is number one, more food scientists emerging, especially in developing worlds like Nigeria, because one of the things that I do is I make sure that our Nigerian and African ingredient has the expression that it has. Yes, I do it for fine dining. I mean, that's why there's a chef by my name. But also, I do it for healthy living because I believe that our food can heal or kill you. One of the things with PCOS is that people get overwhelmed about where to start. And when they want to start, they go straight to the foreign without knowing that we have this thing in-house, right? And so one of the things that I believe that I could see, and that's one of the things I'm advocating about, is the Nigerian food. I mean, I'm coming from the food aspect, right? I'm looking at Nigerian food, Nigerian vegetables, more research. I was talking to my trainer this morning, and I told her, it is important for someone with PCOS to have omega-3. And I just spoke to her right now that I react to omega-3 supplements. I react to omega-3 supplements. So how else am I going to get to my omega-3? I have to take fatty fish. Now, this is the twist. I'm a married woman. My husband doesn't like Titus fish. And the way I was brought up is what I eat is what my husband eats. So if I get Titus fish and the house smell, the first thing you hear is, who bought Titus fish in the house? Right? Okay, so no more Titus fish. But I'll go for salmon. Salmon, a whole salmon. I mean, I'm a chef. A whole salmon is over 30-something thousand. If I want to go and teach people online about how to incorporate omega-3, will I tell them, someone that is earning 30,000 naira, to buy salmon? Of course not. But if there are research, there should be a fish in this Nigeria. It may be shower. It may be herrings. I don't know. There must be a meal. There must be a seed in this Nigeria that is affordable, that can give every woman living with PCOS the omega-3 nutrient that they need. And so the vision for me is that there will be more food scientists, food researchers emerging, and there will be partnership with chefs, because it's one thing for us to do all those fine, and it's another thing for people to see and actually talk about how our foods has an edge over all the, I'm so sorry everybody, broccoli and cauliflower. Our vegetables have an edge, right? So that is the future for me, and I am putting my voice in order to make that happen. I'm looking for every research possible to see how more food scientists are already talking about, the importance of ugu in our diet, more nutrients you can get from ugu, more nutrients you can get from spinach. This particular bean, black beans, we have akidi, we have fio, we have different things. What nutrients are you going to get from this? We have whole rice. Rice is bad. We have whole rice. We have short grain rice. How this rice is going to give us this. How this is going to give us that. And then we put this all together. We need omega-3. Which particular seeds can give you that? How do you incorporate it in your diet? How do you do this? How do you do that? That is the future for me. And the future is every woman with PCOS do not need to spend so much to live a healthy lifestyle and maintain that holistic approach, as against spending so much money on certain meds. But once there are more science, and this is to challenge you, if you are in food science, if you are a biologist, or please go into food science. Do this. Make it easy for our doctor here. Make it easy for us. Make it easy for them, because more of the research you do is going to actually help them. They're actually going to give us the right dose, and when they do this, it's going to help someone like me create a recipe that will be good for you. So that is the future. Thank you.
I love that. Hello.
I just want to mention something, that the awareness should start at young age.
Yes.
So I'm here since maybe 15 years, and I've noticed that we have a generation of children growing with weight problem, especially with girls. And when you have at puberty a girl that have weight issue, later on things will get worse. So education starts in the house, the parents, all the family should be involved in eating healthy. And I want to insist on what she said. So Monday I'm starting diet, I'm going to the supermarket to buy all the diet food I see. No, you can do diet with what you have. It's only to know what to eat. Today I will eat fried pasta, fried potato, then after 1 week I will still eat it. Not every day, it will work. So there's nothing we should stop, only eat in moderation, then we will be fine.
Thank you so much. Thank you. Do you guys have any questions? I don't know. Well, I have something I want to add to everything that these wonderful panelists have said. Your state of mind is always very important. Okay, you have a question? Okay, let's get your question.
Thank you. Hi, Chef Omaka. Good afternoon. This question is directed to you. So I saw somewhere where somebody said that the seasoning cube we use in our meal does a lot of harm than good. And the person was saying that it's better to use sea salt, better to use natural, better to use natural stuff to prepare our meal, because we are using scent leaf, uziza, that's using stockfish, and using more. It's better was saying is doesn't necessarily mean you stop using the seasoning cube, but we use lots of it here in Nigeria, and I feel like most of us, our taste bud has gotten used to using a lot of seasoning in our food, that when there is a meal prepared with little or no seasoning, we cannot eat it. So is this also directed to having issues with our guts and unhealthy lifestyle, unhealthy eating? Thank you.
Chai, my God. Okay. So personally, I do not have an issue with seasoning cubes. I do not, right? And I believe that one man's food is another man's poison. Everybody reacts to whatever they react to. I mean, I just mentioned now, using supplements as an example, that I react to omega-3. Omega-3 supplements. Does it make it bad? No. Based on my knowledge about what's this thing called? The components of what made seasoning cubes. I think one of the key components there is monosodium glutamate, that's MSG. And from my own ideology, you can literally find glutamate in some, and find them even in your soy sauce. You can find them in there are some foods that you can find glutamate. Now, monosodium means there is little salt. That's, I don't know how to put it now. So if salt is 1, monosodium is maybe half, or when you understand the origin, it is not our own. It is actually a cultural ingredient from another country, right? However, there are people that react to it. Do you understand? There are people that react to it, and when they react to it, it's best you stay off. But for someone like me, I do not react to it. One issue I have in Nigeria is the over-dependence on seasoning. One thing you should understand is we need to learn how to build flavors. Once you build flavors, the seasoning cubes becomes the icing on the cake. It's just like when if you want to buy cake for me on my birthday now, I'll tell you don't put plenty icing. I prefer a naked cake. You understand? But what makes the cake have more relevance is not the icing. Yes, it will attract you. It is the taste of the cake. Once you get the taste of the cake right, the icing is just a plus. It's just going to attract you. So what do you do instead? You learn how to build flavors with what? Your herbs. You learn how to build flavors with your spices. That is the reason why you see some chefs, they first of all, they put iru, they make sure that they allow it burn a bit. Or they put onions, they allow it to burn a bit. Because they want it to release the sweetness. They want it to release the sweetness into the oil. And some people, they, like, I was talking to someone that was telling me the origin of how ofada is made. And she said, actually, what people don't know is when you over fry those peppers, it ends up giving you that very sweet flavor that you end up not adding seasoning cubes. That is what quick meal. Do you understand? But when we apply patience, we end up using little to nothing. I will have to say this. I use MSG to help my husband. My husband was hypertensive. He's a medical doctor. Some of you know him. He was hypertensive, and it was reduction of salt and MSG and lifestyle modification, and I was able to reverse, he was able to reverse the hypertensive symptoms that he is currently not on meds, 4 years and counting. And I'm not kidding. And this is someone that has been going for his vitals. He has been going for all his vitals. Every single thing is intact. I mean, he did a brain surgery, and as a result of all this lifestyle modification, it didn't take him 1 week. We were out of the hospital. So all do I need to say? I'm not one that demonizes food, right? I feel that except you react to it, don't use it. But if you do not react to it, use it. But don't be over-dependent on it. Build flavors. When you want to cook your soup, if it means frying your onions, fry the onions, fry your iru, use crayfish, use certain things, and let the seasoning be the icing on the cake. Take your time in the kitchen. Don't spend 20 minutes to cook 1 hour food. Take your time. Build flavors. Dry the ones that need to be dried. Don't cook on high heat. Cook on low or medium heat. Do like that. Continue in that manner. And you see that your dependency on seasoning cubes will reduce. And also embrace our herb and spices. Ever since I discovered curry leaf has not rested in my house. It has not. I blend it in almost anything I want to do. If I want to do rice, I blend tomato, I blend pepper, tatache, curry leaf. When I want to marinate my meat, I put everything, curry, thyme. If I want to do curry sauce, I put my curry, my turmeric, I put garlic, ginger, I put curry leaf. I discover flavors. I use my vegetables very well, especially those ones that have flavors like scent leaves, curry leaves, those ones that has flavors. Use it in unique ways. You end up being less dependent on seasoning cubes. Hope I've answered your question.
Okay, hi. Okay, thank you so much. So I just have one question for Nene and the other panelists. So when you were talking about the future of naturopathic medicine, so if you are very conversant with what's happening on Instagram, you notice that there is sort of like a rivalry between conventional medicine and herbs, basically naturopathic medicine. So I just want to really know, like, what's the balance, you know? When, what steps, do you understand, is naturopathic taking that, okay, people can actually just, you know, come to a clinic and be like, oh, I want you to recommend some herbs and all of that, because we're talking about the future. Also, follow up to that, I want to also ask, so
you know, the way there is this whole start taking supplements, you know, as women and all of that. I just want to really know if, you know, supplements like probiotics, certain supplements, you know, if it's like good for everyday use. So that's just what I want to ask. Thank you.
Thank you. No? So thank you so much for that question. So the beautiful thing about naturopathic medicine is called integration. So it's called medicine. So I've met times where my clients come to us and they're already using, you know, conventional medicine. And what we do in that approach is integration. Because most people still want the holistic view of their... Okay. They don't feel that, okay, I'm getting what I really need. Because the distinct feature between conventional and naturopathic is conventional focuses on symptom management, right? You have irregular period, birth control, you have insulin, metformin. But when you come to naturopathic medicine, we look at every aspect of yourself. So we talk about your mental, your physical, your environmental toxins like BPA, pesticides. We look at everything, even your spiritual aspect. So most people often want to, you know, get that holistic with the naturopathic line. Do you need therapy? Is it just therapy you need? Or do you need more into your diet? Because we have a lot of women come to us, oh, I was just told to lose weight. You know, is this something we need to create a personalized diet plan for you? Do you need some supplements that can help with what you're currently on? Right? Do we need to taper you off what you're currently on? So this is what we do in the integrative sector. Then the other question relating to supplements for women, yes, it's very good when you start supplementing. I understand that we are here talking about how you can get this from your diet, how we can get that from your diet, but the truth is we're in a fast-paced world, right? Most of the time, you might not really, you're always on the go, and most of us are 9 to 5 here. You know, you're in the office, you are here, you are there, you are here. You are even trying to find the balance between how can I even, all these plenty things you people are saying, thank you so much, but how can I make this thing work? You know, that is why, you know, you build up your supplements. You ask your primary healthcare provider the best things that you can take for yourself, like probiotics. If you want to start out with that, is that the best thing for you? Is it now? Should you start it now? Is that the best thing for your health? So personally, you can start out your supplement to supplement what you're currently doing in your diet, and there's no pressure. You can just start this thing one step at a time, one step as you go. How it leads you can just go into this. So, as it.
Okay. Hi, this question is for Chef Amaka. So, so I know you said you don't advise anyone to necessarily stop something unless, you know, maybe you're allergic to it or it's not good for you or you don't like it. Just reduce. But what is your advice when it comes to using oil when cooking? Because you hear a lot of things about vegetable oil, groundnut oil are probably not good for you. They're not as good as olive oil. I have friends who use palm oil for everything. They even use it to fry plantain, you know, potatoes and stuff like that. It's a little gross for me, but now my husband is sort of going to that school of thought, so it's scary. But I guess that's my question. Is there one that you would say is healthier in using to cook, you know, frying things, and in cooking the vegetables that we eat, you know, ugu, spinach, water leaf, things like that? So how do you advise, and in what quantity, you know, would you advise that we use it to cook where at least it's healthier for us and not affecting our hormones?
Okay, thank you so much for that question. First of all, I don't have a problem with oils, right? I believe that some oils have certain things that your body would need. It's just that you cannot. The problem with us Nigerians is that when we cook finish, the oil will just be floating like this. You understand? Floating berry, thank you. That is the problem, right? So, the healthiest oil, according to research, is olive oil. But you shouldn't use, why should you even fry in the first place? You get, especially someone with PCOS, you should actually reduce the way you fry. Will you eat fried things? Yeah, yes, I eat fried things, I eat dodo, but it's not every time I eat it. Maybe like, I've done well for 2 months. I'll now use dodo to treat myself and say you did well. I'll just do it once and that's it. Do you understand? But we should actually limit the use of fried things. You enjoy the benefit of olive oil when it's not fried. You understand? However, olive oil is expensive. Right? I mean, I bought 5 liters recently, over 100K. And it's advisable for a woman with PCOS to actually include this kind of oils in their diet. Right? So, how do I go about this oil? Knowing fully well that it's expensive, I look for a better alternative. Palm oil is good, but we need to use it in caution. Do you understand? It is very, very good for you. Don't mind all those things they are saying. There is nothing wrong with our palm oil. It's true to home, it's our own. However, we shouldn't use it in large quantities. The thing about oil is the way you get, if you want to get the benefit of oil, you shouldn't use it in large quantities. It helps you to want to eat. It has this soothing thing it does to the mouth. But to get what your body needs from that oil, it needs to be used in small quantities. So, I think it's only vegetable oil that people have an issue with, or some seed oils, although I don't know how true it is. I heard that canola oil also has mono unsaturated fat. I found out, right? And however, there are a lot of talks and conversations saying that canola oil is bad. And I mean, I'm in the shoe of someone with PCOS, I'm already exhausted. We will look for how to raise money to buy olive oil. So what do? If you want to go for palm oil, it's fine, but don't use it too much. If you are doing a bowl of soup, a pot of soup, let me say a pot of soup that you are going to eat and then you are going to keep. Let us say you are like you and your husband and maybe a child. Do you have a child? Okay, you and your husband. You are doing a pot of soup that will last you today and tomorrow, right? As against using a full cup or 2 cups or half a cup of oil, you can go as little as going half a full cup or 2 cups of oil. You can go as little as going half a cup. You understand? And how do I successfully do that? I learned this when I found out that, number one, I needed to lose weight, and oil is calorie dense. So the more oil I take, I'm adding weight. So the only way I can do that is to reduce my oil intake. How did I do that? I start looking for alternatives. So if I want to do stews, I'll rather roast my peppers, blend it, it adds flavor. And then when I cook it down, I'll just add oil, just like half cup of oil. It will cook and it will enter properly. By the time I taste it, it's no longer sour. I season it and I'm done. When I want to cook my soup, one of the things I do is I use palm nut extract. I use palm nut extract for that. You end up getting a cup of palm oil. So, why don't I use 1 cup of palm nut extract? So far, it is not too thick. The way we extract, how watery it is, you understand? You just take like 1 cup and then add it in your soup. And then the equivalent may be 1 tablespoon or something. And you get all the nutrients and everything that you want to get from that. I don't know if I'm making sense. I actually thought about it. I had to start asking some dietitians. And that's why I said the future of this is there should be research. Because I looked online, I started searching, I didn't see. And the only thing I asked was, okay, what does 1 kg of palm nuts give me? I saw the size. It was more than like, I think 5 or 6 cups. Up to 10 cups of oil that is not concentrated. The juice, right? And then I now asked, okay, I now looked for what 1 kg of palm nuts will give me in palm oil. I saw 1.5 cup. I was like, okay then, why can't I use just 2 cups? I know that at the end of the day, both of us are eating roughly 1 or 2 tablespoons, and we are good. And so what did I do? I started incorporating it in my soups. I do, if you are from Owerri, please don't be angry. Whenever you cook for Owerri, you put palm oil. I don't use palm oil anymore. I use palm juice. I use palm nuts juice. I'll just take 2 cups and I'm fine. I do that for some of my soups that requires it. Then foods like edikaiko, afang, you know, although there are some food that you cannot escape it. Let us agree. Atama, you can't escape it. You must use enough oil. You must use enough juice, right? There are some foods that you cannot escape. But there are some that you like that you can escape. That you can escape the use of oil. I mean, if you want to cook afang soup or edikaiko, you put oil at the beginning, you put oil in the middle, you put oil at the end. Yes. So, for me to reduce that, all I just do is my meat stock. My meat, once it's reduced, I put like half cup of oil inside. And then I put my vegetables, allow it steam. Once it steams, it comes down. And then I stir it. My vegetables, I've already washed it. I've seasoned it with, I've put salt to help to make it come down. I rinse it up, it becomes soft. I sprinkle it, and then I mix everything. I don't need to put oil at the end. It's only afang soup that I end up putting maybe 1 soup spoon at the end, right? So that's how I do oils. So the only way you can benefit from oils is by using it in small quantities. Please, I'm sorry for taking so much of your time as regarding oil. No verse, I beg. Thank you.
Good afternoon. Let me stand so you can see my face. So I want to thank everyone for everything you said. So a brief introduction. I'm a final year pharmacy student of the University of Lagos, and for my undergraduate research, I actually researched on a plant that improves fertility in both male and female. And in fact, I'm defending my project on Wednesday. So I'm very much passionate about, hormonal imbalances, infertility issues. And I was thinking, after I finish my school, I want to, go into researching into more herbs that can be standardized, so that we can, extract the bioactives and turn them even into, drugs. So I was just looking, but I just want to ask everybody that how do we assess organizations that actually, sponsor people to, go for more research, because research is money. I know how much I spent on my undergraduate project. So do you know of organizations that are ready to sponsor people that want to go into research for hormonal imbalances and infertility? Yeah, thank you.
Okay, let me answer that question. Thank you so much. I'm happy to see this happening today. So NAXA Wellness, we encourage people, we bring people on board, and we sponsor. So we're really open to have you on our team, to work with us, and if there's any resources that you need to push your research, we're down to help you. So maybe at the end of the show, we can talk, and yes.
Good afternoon, everyone. In as much as we all know that diet is one of the major important steps in managing PCOS, and of recent, I noticed from research that most of these food, they contradict each other. Why do I say this? For someone with high prolactin and as well trying to reduce weight, they will tell you that you have to take oats every day. It's part of the diet for PCOS, for people with PCOS. And taking oats, from research, it says that oats increases high prolactin, why as well is working for you to reduce your weight. So in that situation, what do we do? Not only oats alone. Talk of flaxseed. They will tell you that it's sugar level, and as well it increases high prolactin. Also, they will tell you, if you want to reduce your prolactin level, you take more of beef. As well, they will tell you that eating beef increases blood pressure. So how do we inculcate all these diets? How do we balance them in treating or managing PCOS? Thank you.
Yeah. So I want to first tell you that you need to check your resource. Google is full of wrong things. The first thing you write, headache, brain cancer. So to start from here, you need to go to specialists. So first, if you have an hormonal balance, you are going to either your gynecologist or your endocrinologist that is specialized in knowing your own situation. So what works for you maybe will not work for your friend that have the same problem. So it's very personalized. You can read an article about oat, it's very healthy, and another article you will see that is high in calories. It's something that it's not applied in general. And when we have a hormonal problem, medication is a must sometimes. It's not only we regulate it with the food. So first we take medicine. That's something we cannot, we cannot not to do it. Then food, supplements support it. But sometimes we have a medical problem that need doctor intervention.
I would like to add to that. Another thing is you need to work with a dietitian. You cannot escape it. You need to work with a dietitian because the dietitian will look at all your results and give you the best and the appropriate food that is good for you. Let me digress a bit. I saw a post by Ask the Dietitian. She posted it on her story. She mentioned that there was someone that is diabetic. She was giving the person oats. Oats is actually good for diabetic people. But this particular patient, his reading was not coming down. She became worried and had to go and reinvestigate all the foods and found out that oats was the problem. Oats, no, just oats was the problem for this man. Do you understand? I was talking to another person. I didn't manage PCOS properly, and it grew into high sugar levels. And I was talking to my co-PCOS person, and she told me that yam increases her own. And I told her, yam is so sweet for my body. My body loves yam. Another person is potatoes. Mine, potatoes doesn't do anything. Do you understand? So, at this point, as much as medicine is important, because I will emphasize on it, I take my medicine, right? And I take my supplements. But you need to work with a dietitian. Dietitians, I call them the doctors of food. I talk them the doctors of food. They are the ones that own this food thing. Do you understand? The doctors will just tell you, advise you what to do based up of the knowledge that they get, because they studied nutrition pathway. Dietitians, nutritionists, they went full into food. So they will definitely take all your results and analyze it one after the other, and then pick the particular food that will work for you to give you that whole result that you need. Apart from dietitians, she too, people in her profession who also do the same thing, because they believe in food all round, right? And then they are also going to provide you with supplements that will help you in managing that situation. Do you understand? Hope we answered your question. Are you clear?
Are you
Are
clear?
you sure?
Well, I hope that you've been able to learn a lot of things. I just want to say that whatever you want to start to do, you have to do with love. You can gain weight, you can lose weight. We live in an environment where people are very upfront. Someone can see you and say, "Oh, you look like you look." You know you look like that. So my thing is, don't start things off just your physical appearance or wanting to be accepted. Accept yourself. This is your life. Manage it the best way you can, and the sky is the limit. So, yeah, good luck. Thank you so much to our wonderful panelists. Can we give them a round of applause, please?
Thank you so much to our panelists. Thank you so much to the moderator for doing a beautiful job. And of course, the questions were very intelligent questions that required intelligent answers. And I'm sure that a lot of people have learned from this particular panel session. It's been a very wonderful one, a wonderful course of event altogether. But without wasting time, we'll be going straight to the award session, the award ceremony. This is where we'll be celebrating and recognizing the contributions of certain individuals to PCOS awareness, as this is a huge deal for us, as you already know. And without wasting time, I'd like to bring up stage once again the co-founder and the CEO, Sheyi Amao, who will be presenting these awards to the certain individuals. So please, a round of applause for Sheyi Amao as she comes up stage.
Hi everyone. Okay, all the awards here. Okay, yeah. Good afternoon. This has been a day well spent. Thank you everyone for hanging it with us. So just to give a bit of genesis on the award, like I said earlier when I spoke, for me the vision is that when we leave here, a lot of us are empowered to do more. You know, like I said, it's not just a conference for just us to celebrate 5 years. It's also a charge for people to use their stories and make impact. So we'll be celebrating today and recognizing both people who have used their story. Not only were they diagnosed with PCOS, they didn't let that be the end of it. They took their platforms and made impact. So we call them champions. So we'll be celebrating champions, and we'll also be celebrating supporters, because finding, you know, medical help or even solutions to help you can be quite difficult. So people within our community had spotlighted a couple of people that had been a great resource for them. So we're just starting with them, and if they're in, I know some of them are in, some of them sent representatives. So if you can just celebrate them as they come, we really appreciate. So I need someone on stage with me with the award so that I know who, so we can know who we're given. Yes, thank you. Thank you very much.
DJ, light music, please. Okay, so very quickly we'll be starting with the champions. And first on the list, and this is in no particular order, by the way, the first recipient of our award for this year's conference is none other than Chef Amaka Nwakalo Egemba. A round of applause, please. Please, once you receive the award, do well to pose for a photograph with the CEO and co-convener. Thank you very much. Chef Amaka Nwakalo Egemba has been really helpful and instrumental using her page to shine the light on PCOS.
I be king, I'm the best my generation ever seen. I came suddenly, I be like never be. I never since, I never miss. I be smashing, I be killing everything. From Ikeja to Ojuwe like Babi, to the many places that I've never been. Remember this, I'm a king, I'm a legend in the making, I'm a champion. Remember this, I'm a king, I'm a legend in the making, I'm a champion.
Ladies and gentlemen, the second recipient of the Champions Award for this year's conference is none other than Tosin Ajibade. A round of applause, please. Is there a represent? Okay, please, a round of applause for a representative as she comes forward. Of course, the next recipient of the... Hello. The next recipient of the Champions Award is Stephanie Coca Aderinoku. Please put your hands together for her. The next recipient of the Champions Award is Mama Charis Idara Ekoriko. A round of applause, please, for Mama Charis.
1 second, just to comment on that. Mama Charis is actually not here. In fact, let me share her testimony. She had 2 blood fallopian tubes when she joined our group so many years ago. Not only were her tubes open, she's now just giving birth to her 2nd baby. She is a mighty warrior. Like the way she rallies people within the group. I wish she could be here. I know they are watching online, so we'll send her award to her. She's all the way in Port Harcourt. This is not Lagos. So I bless God for her. She is a blessing. So yes.
Please put your hands together for Mama Charis. All right, the next recipient of the Champions Award is Enna Esigye. Please, a round of applause for Enna Esigye as she comes forward to receive her award. Champions Award for the conference 2024, Enna Esigye. The next category we'll be going into is the Supporters Award. This is the award given to those who have really supported and rallied around this particular initiative. And the first recipient, again, in no particular order, is none other than Adiola Omoshalewa Adeleye, MSHP RDN. A round of applause, please. AKA Ask the Dietitian. Adeola Omoshalewa Adeleye. Okay, all right. And the next recipient is Dr. Babatunde Ogunkile, Origin Fertility Clinic. Is there a representative? Please put your hands together. The next recipient is Dr. Chinasa Amadi, Ariella Health and Fitness. Dr. Chinasa Amadi. While we wait to see if there's a representative for Dr. Chinasa Amadi, the next recipient is Naxa Wellness. Put your hands together, please, for Naxa Wellness. Founded by Nene Adedoko, Naxa Wellness has been very instrumental and supportive for the course. And of course, the next recipient of the Supporter Award is the Fertility Conversations. The Fertility Conversations. Please put your hands together for the Fertility Conversations. If there's a representative, please come forward now. Of course, last but not the least in this category is the next recipient of the Supporter Award is the Health Place. The Health Place. Please put your hands together for the Health Place. And with that, we've come to the end of the award ceremony, but I want to take this time to say thank you to every single one of you for rallying around this course, even for being here. It shows that you're passionate about this, and this is just the beginning. Let's keep the fire burning. Please, once again, put your hands together for all the award recipients and for yourselves for being here. And a big thank you once again to the co-founder and CEO, Seyi Amao. Speaking of which, we'll go straight to the cutting of the cake now. We're about to celebrate the 5th year anniversary of the PCOS Awareness Conference 2024. And then we'll be cutting the cake very shortly. And of course, once again, I'd like to invite, as the chief cake cutter, if there's anything like that, the co-founder and CEO, Seyi Amao. And of course, I would like to invite the co-founder and COO, Anu Omotara, to join her as they cut the cake. Please, a round of applause. So they'll be cutting the cake together first, and then right after that, we'll have the photograph session where we'll have the PCOS community members, friends and family as well, and then the panelists. Anu Omotara, co-founder and COO, please, your attention is needed here. All right, ladies and gentlemen, I would like to invite upstage at this moment the PCOS community members. So please, if you are a community member, we need you up now to join her in cutting the cake. A round of applause as they come forward, please. PCOS community members. Please, let's try to make it snappy. PCOS community members, we need you upstage to join the co-founder and CEO in cutting the cake. All right, this is going to be a collective effort, ladies and gentlemen. I would like for us to scream at the top of our lungs, PCOS Conference, PCOS Awareness Conference 2024. And after that, they will cut the cake. Are we ready? Are we ready to cut the cake? So at the count of 3, you scream on the top of your lungs, PCOS Awareness Conference 2024. Ladies and gentlemen, 3, 2, 1. A round of applause, please. A big congratulations to the community members, the organizers. This is no mean feat. It's been on for 5 good years, and it's been a beautiful journey. And this is to many, many, many more years to come. PCOS Awareness Conference is here to stay, and this is just the beginning of beautiful things and more beautiful testimonies. A huge congratulations to the community members.
A celebration to last throughout the years. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now. Celebration. Let's all celebrate and have a good time. Celebration. We gon' celebrate and have a good time. It's time.
All right, right after this, please, I would like to invite all the panelists, whether for the first panel session, the second panel session, to come join for the photographs. Please, immediately after this, all the panelists, you can start coming forward so that we can save time. Thank you very much, all the panelists. First, second panel session. We need you upstage for a photograph with the CEO and co-founder.
Let's celebrate. There's a party going on right here. A dedication to last throughout the years. So bring your good times and your laughter too. We gon' celebrate and party with you. Come on now. Celebration. Let's all celebrate and have.
Okay, please, very quickly, I'd like to invite the friends and family members. Family and friends, it's time for you to take pictures. Family and friends, please come forward to take pictures with the CEO and co-founder. Very quickly, please. Family, friends, well-wishers, or you wish to be family. Let's make it snappy, please. Family, friends, well-wishers, please come forward to take a photograph. And please Please, can we also celebrate the assistant celebrant for today, Mr. Mayowa Amao? A round of applause, please.
Let's celebrate. Come on now. Celebrate good times. Come on. Let's celebrate. We're gonna have a good time tonight. Let's celebrate. It's all right. We're gonna have a good time tonight. Let's celebrate. It's all right. Baby. We're gonna have a good time tonight. Let's celebrate. It's all right. We're gonna
All right, ladies and gentlemen, very quickly, I would like to crave your indulgence. We're almost done, and in no time we'll be taking the announcement. But we did see a documentary video, a very brilliantly presented documentary video earlier on, and we have someone who will be speaking to that video. So ladies and gentlemen, please join me as I welcome Okpeyemi Kautha. The title of the documentary is Beyond the Symptoms, and she'll be talking about the documentary. Please, a round of applause for Okpeyemi Kautha as she comes forward.
Good afternoon, everyone. First of all, thank you so much for having me. Thank you so much, Shea Amao, and thank you so much, everyone here. My name is Okpeyemi Kautha Lawal, and I'm a health practitioner. I'm also a nurse midwife by profession. I'm the founder of Looking at Our Care. And like she said, I'm a team lead for the documentary that we named Behind the Symptom. So I'm just going to tell a quick story of how we're able to arrive to producing the documentary you watched earlier in the morning. In the course of my journey as an health practitioner, I've had first-hand interaction with a lot of girls and women who have reached out to me severally, talking about their pains, talking about their struggles on PCOS. And that was how I realized that a lot of people out there have little information, little awareness about polycystic ovary syndrome. And beyond what we see, a lot of people are actually passing through a lot. Is it psychologically? Is it mentally? Is it financially? You know, a lot of things. And that was how we came about with the name Beyond the Symptoms. When you look beyond the symptoms that people see acne, people see weight gain, people see all those things. But beyond those symptoms, there are a lot of things that people living with PCOS go through. And that was how we're able to come up with the documentary. We've been on the documentary since last year, 2023. And I'm happy to announce that we are done with the documentary now. And thank you so much. And thank you so much. So you were able to watch only 5 minutes from the documentary. It's a 40-minute documentary launch. So our aim is not just to do a documentary. As a health practitioner, like I said, we want to do a lot of things even after the documentary, because I realize that for people out there, for a young child out there, we need to catch them young, yeah? We need to let them know what PCOS is, because these teenagers, they're having the symptoms, but they do not know that it's called PCOS. So we are going to have a school tour. We are going to secondary schools. We'll visit secondary schools. We'll visit universities to screen our documentary and to interact with people, to create more awareness, to create advocacy about polycystic ovary syndrome. And our, premiere will be coming up soon. It will be an honor to see beautiful faces here. When it's out, I also informed Shei, and she said, okay, no problem. We'll talk about it and all those. So it will be an honor to see your faces, to come and grace us at the event, you know, to talk about this conversation. It's high time we start creating more awareness about polycystic ovary syndrome. It's high time, and the best time is now. Not tomorrow. The best time is now. Thank you so much, everyone.
Please, a round of applause for Okwemi Kauthar. Thank you so much, and that was a beautiful, beautiful documentary. Now, very quickly, we'll go straight to the announcement, but I would like to remind us, I did mention earlier about the puzzle at the back, and I haven't forgotten, so if you filled it, I need you to do me a favor. Please just write your name and your social media handle, wherever you are most active, your social media handle on it. So the ushers will go around now once you've written your handle and get it, and then we would reach out to the winners and, of course, expect our gifts. Please help me do that in few minutes. Now, while that is being done, I would like to call up stage again our co-founder and CEO, Sheyi Amao, to give the announcement and partnership details. Very quickly, please give a round of applause for Sheyi Amao as she comes forward. And don't forget to write your handles and submit it to the ushers. The ushers are waiting. Please give a round of applause for Sheyi Amao.
All right. Okay, Anu is also here. So Anu is here. We need one more mic. I think I saw one. Okay, over to you. Okay, so we have exciting things that we've been working on. Just want an all clear from media if you're ready to project. Tolu, any sign? Are you ready? Oh, okay. Okay, so I can go first. I was also hoping to project, but it's fine. So one of the partnerships, but that one's okay. So one of the partnerships that we have been working on is in terms of supplements and access to medicine. I want to say drugs, but drugs can be interpreted in a different way. So access to medicine. So we partnered with PharmaRun, who are, they have a whole service when it comes to delivery to ensure that medication can be, they handle the last mile when it comes to medication. So, and part of the things we've introduced together is a starter pack for people that have been diagnosed with PCOS, because it can be a very jarring thing, but what we've come together is to say, hey, we've put this package on different plans so that once you get diagnosed, you already have everything you need, from nutrition plan to like the basic supplement that you might need to just have to get you started, to like a coaching call and everything. So that's one of the major things that have come out from our partnership. And when you go outside, you see the PharmaRun stand, you get to see and learn more about it. Thank you very much. Round of applause.
Okay.
Are we ready? Okay, maybe we just go ahead, yeah.
Okay, so, all right, I'll just read it from my phone. So another exciting partnership that we want to announce today is one that is very dear to my heart because the founder is my cousin, and I've also worked at that establishment. It's just one of the greatest startups out of Nigeria right now. So has anyone heard of Economy here? Yes, okay. So if you have the Economy app, go to your app. If you don't have it, go to your Play Store or your Apple Store and download the Economy app. So I'm just going to give everyone a couple minutes to do that. Is that okay? All right. So when you download the app, 1 minute, just 1 minute. Are we all on our phones?
Economy.
HERCONOMY. Okay. If you've downloaded the app, let me just see your phones up. Yay. Okay. All right. So once you have the app, you create or log into your account. So you have to create one. Okay. So once you've done that, you find the PCOS Savings Challenge. And what this, you click on join plans. So you can search for the PCOS Savings Challenge on the Economy app, and you select the PCOS Savings Challenge plan. You add your card to the Economy app for automatic debits, and then you choose the savings plan you want. So if you want to save weekly or you want to save monthly. So weekly, the maximum is 1 million naira, and then monthly, the maximum would be 2 million naira. Yes, and then at the end of the savings time, which is in 6 months, we will give you 10% of what you've saved, like absolutely free. And then you can double check all your savings details and click confirm to officially join the plan. And so why we're doing this is healthcare is expensive and supplements can be expensive, and as some of you have PCOS, you've been buying supplements, you go for a checkup or a scan, or some who want to have babies have to do IVF treatments. And this will just help you, save money with the community, and can, just a fun way to have a challenge to just, and also cultivate that savings habit. So this is what we're doing with Economy, and I just want to see everyone saving with them. And I'm also going to join this plan, and let's see who wins.
Yeah, so please download the app. Oh, it's there. Okay, fantastic. Again, it's just that, you know how people talk about Vex money, you also need, I don't know, is it fertility money? Yeah. Yeah, because it's not easy. Like, yeah. I remember, like, when I had to have an operation, and it's like, I just got paid, and I can't remember what operation it was, but it cost, like, probably over $500,000. And I was just like, as my salary was dropping, I was just like, boom. I was like, oh, God. But I needed to do it. But then again, if I had already gotten into a habit of having something set aside for my wellness, because this is a wellness challenge at the end of the day, you need to have money for your health. Women, it's like what I say, don't ignore the pain. Sometimes you will feel like, oh, there's something tingling in your leg, but you'll be like, when you think about the cost, you don't want to spend that money. So we're building a habit of putting aside money for the next 6 months, so that at the end of the day, we would always have something, regardless of whatever we need to do. I mean, some people save towards BBL. Why can't we save towards?
Why not?
Why can't we save towards healthy ovaries? So so thank you very much. This is something great for us. Thank you to Economy for being such an amazing partner, and we're looking forward to many more things together. Thank you.
Ladies and gentlemen, please a round of applause for our co-founders, both co-founders, for giving that beautiful vote of thanks. And I just want to say that it's been a beautiful, beautiful event, PCOS Awareness Conference 2024, and this is not the end of it. And like the co-founders said, next year we're looking to go into the streets to cause actual change. We're tired of looking pretty and sitting down. It's okay to come for conferences, but we're looking to cause meaningful change. But before next year, what you can do is support people who are going through this, is support these causes. This is a very beautiful initiative, and it should not end at conferences, right? We can all lend our voices to make sure that people are more aware of this, especially those in the rural areas. So thank you so much. It's been an absolute pleasure being your host. My name is Blessings Mosugu. Have a beautiful day as you step out. Thank you. All right, please don't forget there's still free massages in case you didn't get one earlier. When you step out and you feel your body's tight, just get to the hall by my left, by your right, and then get yourself a free massage. And of course, the cake as well. So when you're stepping out, you can get cake for yourself. Thank you so much. So please, if you dropped your name earlier for either the BP check, the scan, whatever it is, please, you can go back and continue. Thank you so much. They're waiting for you. And don't forget to pick up your cake before you go.
Please, can I have all the volunteers to the front, please?
I don't talk, they get spot, I get good. They want test from me, I don't fall. They don't set traps, I no fall. But in mommy every city, move for one leg over my you.
Okay, so please, if you're part of the 25 persons, the first 25 persons that dropped your name, please go to the front desk. We didn't forget about you. So please go to the front desk outside the hall. Thank you so much.
Baby girl, I don't mind. You go be my wife. When you down, you can call on me. I'll be at your door. Even if you slow.
Yay! Where are all the volunteers? We want to take pictures with the volunteers, please. Where's Tumininu, Nafisa, Victoria? You can also get free massages.
Call your name when I ask me that guy is my guy. He's not my guy, not my guy. Love is not enough, baby. Come to me, Molo. Love me or you hate me, know me. No mess with me, Molo. NSC 250, come along. Nothing in a Maserati. Hey, baby, easy. Fine boy like you, easy. You won't kiss somebody.